day 3 of our conference. Our exhibit hall is open from 8 o'clock a.m. to 6 p.m. today and tomorrow. Remember that in order to get your continuing ed credits, you have to complete and hand in your verification form before you leave. You can't mail it in later. You have to complete it before you leave and hand it in before you leave. Any handouts or PowerPoints the presenter has made available for this session are available on the Groupio app, or there's QR codes in the back of the room above the water and outside above the sign with the title of the presentation on it as well. This afternoon, there are going to be 2 special events from 4:30 to 6:30. The first is a poster exhibit which will focus on research in the field and program expositions. The Art of Expression exhibit from students with autism around the state, and light refreshments and a cash bar is in Dean's Hall 1 and 2, and that's 4:30 to 6:30. There will also be a PDE and patent event seeking input from parents, educators, and anyone else interested in transition needs regarding post-secondary education and workforce preparation. That'll be held after Dr. Peter Gerhardt's afternoon presentation in President's Hall 1, which is just 2 doors down from here. I'm very happy and proud to introduce Dr. Vince Carbone. He's a board-certified behavior analyst doctoral degree with over 35 years of experience educating and treating persons with autism and developmental disabilities. He received his graduate training in applied behavior analysis at Drake University, Des Moines, Iowa. He serves as an adjunct faculty member on the Penn State University. He served as a visiting professor in the behavioral education doctoral program at the Simmons College in Boston, Massachusetts. He currently holds teaching appointments at the University of Salerno, Italy, and Istituto Europeo, sorry about the pronunciation, per lo studio del comportamento umano in Milan, Italy. His teaching responsibilities include courses in applied behavior analysis and verbal behavior, and his behavior analytic research has been published in several peer-reviewed journals, including the Journal of Applied Behavior Analysis, the Analysis of Verbal Behavior, Behavior Modification, Behavior Analysis and Practice, and others. Dr. Carbone has served on the editorial review board of several peer-reviewed behavior analytic journals. He's provided the BCBA, he's provided preparatory training to hundreds of persons seeking board certification as behavior analysts, BCBAs, in several states as well as overseas. He's the director of a center-based clinic for children with autism a few miles north of New York in Rockland County, New York, and he also currently runs a clinic in Dubai. On a personal note, Dr. Carbone's work has influenced what we do in Pennsylvania extensively. His research, as well as the programs that he has helped to create, are unbelievably influential here in the state. And I personally can't thank him enough. He's made me a better behavior analyst for it. So thank you very much, Dr. Carbone.
Thank you. Thank you. That was very kind remarks. Thank you. Thank you very much. Well, it's nice to have an opportunity to be with all of you, and thank you for coming to this session. The title, as you can see, is an introduction to the analysis of verbal behavior and autism intervention. This is listed, at least classified, as a beginner's session, so it will be maybe some information some of you already know. I hope it will add some additional information. We also have a webcast audience watching this, so I hope it meets their needs. One comment to the webcast group is that the videos that I will be presenting here to the audience here will not be viewed on the webcast, mainly for the confidentiality related to the students and broadcasting beyond the scope of this presentation. So while I'll describe them and you'll see them, you won't see them, but I'll describe them and I'll talk about them. The group here will see of course, we'll see the videos. For how many of you is this a beginning course as it's designed to be? How many is this, for you, is this the introduction to Skinner's analysis of verbal behavior? Only a few of you. Good, okay. How many of you are board-certified behavior analysts? Okay, good. How many of you are parents of children with autism? There's a few, good. How many of you are speech-language pathologists? Okay, few. How many of you are occupational therapists, physical therapists, psychologists, physicians who treat children with autism? Okay, very good. Okay, well, I've got an idea of who the audience is. How many of you have heard me speak previously on this topic? Okay, good. Well, there won't be too much repeating. Like I said, it is a beginning course, but I hope it'll meet everybody's needs, even those of you with more advanced understanding and experience in this area. I hope it will meet your needs as well. What I intend to do is to first go through a description of what this behavioral analysis of language is all about and what Skinner's analysis of verbal behavior is, and contrast it with the more traditional and more well-accepted, if you will, analysis of language provided by others in the linguistic, psycholinguistic, and developmental areas. And contrast the two approaches so that you get a good idea of where this fits in to our understanding of language. So that's one of the first things I'll do is go through that. Then I'll show you, based upon Skinner's classification, what all the skills are that we typically teach to young people or people who have acquired very little language, despite their age, but have acquired very little language, how we go about teaching that, both in terms of natural environment teaching and discrete trial instruction, and how you teach each of the verbal skills that we'll talk about based upon Skinner's analysis. Then we'll do a little section on manding, and manding, right now I'll use the word requesting or asking for things. We'll do a little section on simple to more complex manding, mainly because it's an important component of a beginning program for children with autism and related disabilities who've acquired very little language skills. And we'll go through a little bit on manding, and then I'll end up with extensions of language development and manding into social skills, social pragmatic skills, and if I have a chance at the end, we'll talk about length of utterance. When do you go about increasing the number of words that a child says in a sentence, and when's the best time to do it? Now, I'll mix in a number of forms of verbal behavior where I'll show vocal children, I'll show children with who use sign language because they're not vocal, and I'll show children who are not vocal, and we use alternative communication methods such as picture selection or selection-based, using mainly an iPad in order to teach the skill to young children. So that's kind of the progression of where I plan to go with this talk over the next 3 hours. I guess we'll take a little break after about an hour and a half or so. Throughout the presentation also, I will intermix lots of videos, as I said earlier, to kind of highlight and illustrate the points that I'm making throughout this presentation. How many of you have the slides in front of you? Okay. It will tend to help a little bit if you can have them by pulling them up on your iPad or computer or whatever. I think it'll help a little bit to follow some of it, but if not, that's okay as well. I'll make reference to several publications. Most of them will appear on my website, carboneclinic.com. You can pull up the full text for most of our, I'll talk about other publications, but our publications from our clinic in New York. You can see you can get full text copies of the publications that I refer to. Well, let's first talk about what this means to have a behavioral language program. What does that mean? Well, first of all, it's a program of teaching language that relies on the basic principles of applied behavior analysis and behavior analysis in general. And those principles are things like reinforcement, extinction, stimulus control, motivation. So a behavioral program related to language utilizes the basic principles in order to teach language. That's one of the distinguishing characteristics of a language program that uses a behavioral approach. Those principles have been shown to be quite effective in teaching persons who don't acquire skills typically, and acquiring a lot of other skills as well, and therefore it makes good sense to make use of those principles. ABA practitioners who emphasize the teaching of verbal behavior use these principles as their foundation for the teaching. Now, you have to distinguish also between ABA programs that make use of Skinner's analysis and ABA programs that don't make use of Skinner's analysis of language. All ABA programs teach language. Some make use of Skinner's analysis of language, which is what we're going to be talking about, and which I consider the behavioral approach to language. And then there are ABA programs that don't make use of Skinner's analysis. For example, some of the early Lovaas work, for example, certainly language was a major component of that program, of those programs. However, they did not make use of Skinner's analysis of verbal behavior. So we're going to make a distinction between ABA programs that do make use of it, ABA programs that don't, and then programs that don't make any use of a behavioral approach at all, and kind of compare and contrast them so as to give a context for what this behavioral language approach is all about. Generally speaking, behavioral programs that make use of the basic principles, that's kind of the defining characteristic. They make use of reinforcement extinction to teach certain skills, all have certain things in common, as does a program that makes use of Skinner's analysis, and that is precise organization of the environment, daily interventions, frequent intensive daily interventions, teaching of both speaker and listener behavior, in other words, expressive and receptive language, and then, of course, the use of discrete trial instruction and sometimes natural environment teaching, sometimes referred to as incidental teaching. So most ABA programs make use of those sorts of methodologies, those sorts of concepts and principles are embedded in it. Then what's different about an ABA program that makes use of Skinner's analysis of verbal behavior to teach language? First of all, make use of the classification system developed by B.F. Skinner and basically provided in extensive detail in his 1957 publication of the book Verbal Behavior. Now, I describe it as Skinner's analysis of verbal behavior. Actually, it's nature's analysis of verbal behavior. Skinner merely uncovered it. This is not a theory about, well, we're going to teach some mands, we're going to teach some tacts, we're going to use these kind of words, and this is Skinner's theory that he came up with through extensive study. What he did was study language and study behavior in general, and he uncovered the natural laws that guide what we do. So this is a natural language approach, a natural approach to teaching language. Nature decided this is the way language would be taught and learned and acquired. Skinner merely uncovered those principles in the same way that scientists have not invented certain scientific laws. They've merely uncovered them through their experimentation and therefore can make better use of them in helping people and in accomplishing many good outcomes. Same thing with Skinner. His experimentation led to the uncovering of the natural laws that govern the acquisition of language. Reinforcement, extinction, stimulus control, motivation, those basic principles are all natural laws. It's not a theory about how things work. This is the way things work, and there's been enough research to demonstrate that these are natural laws that whether you think they occur or not doesn't matter. Sort of like you can ignore gravity, but you're going to run into some difficulties, especially on top of buildings if you decide to step off. That will be one example of where gravity will get you in the end. So you may not like gravity, but if you don't obey it, you're going to have lots of problems. Same with these natural laws related to behavior and language. You can ignore them, but without them, you won't produce the kind of outcomes you hope to produce in helping children with autism learn to speak and helping people in general. So that's what we're talking about when we talk about his classification system. We'll go through an analysis of his classification system in just a little bit. Secondly, what constitutes a behavioral program of language? Emphasis upon motivating operations. Now, almost all programs that teach children with autism talk about motivation. I'm talking in particular about the concept or principle of the motivating operation as uncovered by Dr. Jack Michael and written about and extensively researched. There are many manuals beginning in 1996 with Catherine Maurice manual all the way up to 2003 with Lovaas's manual on manualized versions of how to treat children with autism. They all talk about motivation, but there's only one reference to the motivating operation as a concept. So when I'm talking about motivation as an important component, I'm talking about using the principles and concepts related to the motivating operation as explained by Michael. And I'll go into more detail. If that doesn't immediately ring any bells, I'll go into more of that. So we'll be talking about the motivating operation and its importance. Thirdly, reliance on a curriculum of skills that are broken down by Skinner's analysis into the different categories of language development, and the VB map is one of the best instruments that look at that. So I suggest the assessment process and the development of goals and objectives be derived from the VB-MAP, which I think is one of the better assessments that lead to a better outcome with children with autism. That is one of the defining characteristics, is a sequence of curriculum activities that are based upon this analysis of verbal behavior, as I suggested earlier. Fourth, the use of stimulus control procedures. Well, let me describe that. In some situations, there wouldn't be any need to, but let me describe it here. Stimulus control transfer means we start teaching a child language with the skills that they already have. And then we turn those skills into more complex skills through prompting, fading, and reinforcement. Let me explain what I mean. If a child can echo, repeat back the word pen, that's a good starting place. If I ask that child, what's this? It's very likely, a child with limited skills at about 5 years old, let's say, or 3 years old, that he or she will be able to say pen. But I know they can say pen under one condition, and that is if I say pen first, they can say pen. They can echo it. So maybe I can transfer control from this prompt, this echoic prompt, to this item through a teaching procedure. In other words, I want to turn his echo into a label. We call those tags. So I'll do something like this. What is it? Pen. The child will now say pen. But they say pen mainly because they're echoing it, but the pen is also present. Now I'll fade out my prompt and say, what is it? And what I'm trying to do is get the child to say pen when they see this object. So now it's gone from an echo. Now it has some meaning in the world. The word pen means that thing. Now I say pen in the presence of that. That's called stimulus control transfer. So I start where a child's at. And I say, what skills does this child have? Okay, I'm going to use those skills. After I do a VB-MAP assessment, I'll know, and I'm going to transfer it. So I'm going to take his language from just being able to echo into meaningful functional language by teaching him commands through echo to man transfer. I'm going to teach him labels by doing echo to tact transfers. And then I'm going to take his labeling repertoire, and I'm going to turn those into what we call intraverbals. And I'll go through these in more detail in a minute, but responding to WH questions. I'm going to transfer across the categories. And in fact, between the ages of birth to about 2 to 3 years old, and it continues throughout life, but when language is developing in a rapid sort of way, you will actually see these transfers occur in typically developing children without any programming. The child knows the word as a label, and suddenly then he knows it as an answer to a question. He now can use it when he wants to ask for things. These are these different categories, and you'll actually see the transfer. Generally speaking, children develop mans early on and some echoes. Once they develop mans and echoes, they all transfer into tacts. Once they have a large tact repertoire, they all transfer into responding to what other people say, intraverbal. And you can see that progression between birth and about 3 years old. And I'll describe it to you in more detail when we get to that section. So you can see those transfers. So we're going to use the naturally occurring transfers that occur to teach language to children who are not acquiring it typically. We're going to mimic typical development in our program to teach language. And you'll see more of that in a minute. You're going to see all these transfers actually operating in some of the videos. The final and somewhat tangential characteristic of a verbal behavior program, so to speak, and I don't use that term very often, but I'll use it for just a minute here, a behavioral language program, is that it includes reliance on the literature of topography and selection-based. What that basically means is that, generally speaking, people who make use of this analysis would prefer to teach gestures in the form of sign language to people who don't have vocal productivity, as opposed to using pictures, the iPad, and so on. We'd prefer most times to use sign because of some real advantages to it. Sign is called topography-based. Picture-based systems like the iPad are referred to as selection-based, selecting pictures versus forming the form, so to speak, or producing the form, topography meaning form. And when you present this form, you're asking for a cookie potentially, or referring to a cookie. So those are the characteristics. I'll do a little more discussion of that as well. These are what characterize a behavioral program. of language development. Now let me give you some facts about verbal behavior that I think are important. Number one, verbal behavior is not a method. In other words, it's not like, well, I do verbal behavior. There's no such thing as doing verbal behavior. That makes very little sense. Verbal behavior is not a program. It's an analysis. It's an analysis of how language develops. So what you usually talk about is you make use of the analysis of verbal behavior, but you don't do verbal behavior. Verbal behavior is not a program. The analysis is based upon Skinner's analysis, which is the uncovering of the natural laws. Verbal behavior is not a separate discipline, some new form of ABA. It's just more behavior analysis. It's not as though you would say, well, I'm not going to use behavior analysis, ABA. I'm going to do VB instead. I'm going to use that instead of ABA. Verbal behavior and the analysis of verbal behavior is just more applied behavior analysis, is more ABA, not something different from and separate from. It's just applied behavior analysis applied to a very important repertoire we call verbal. Merely applying the principles to an important repertoire called verbal, along with a classification system that nature decided and Skinner uncovered. It's not a new form of ABA that replaces the old-fashioned LOVAS. We don't do that LOVAS stuff anymore. We use the newfangled ABA, a VB approach. That's why I don't like using the term verbal behavior program, verbal behavior approach. What you really have is a program using the basic principles of applied behavior analysis, and we call that an ABA program, and in addition we make use of Skinner's analysis. Some people who run ABA programs don't make use of Skinner's analysis, but that distinction is important, especially for people who might be beginners in this or just being introduced to it and are consumers of what should I train in, what should I have for my child, what should I choose a VB versus the ABA. I want to make that distinction that it's all behavior analysis if you're in the hands of good providers and good trainers. It's just more behavior analysis applied to language so that you can sort out in the marketplace the differences in approaches and make good sense of that, I hope, through some of the information I'm provided. So there's no choice between an ABA program and a VB program. There's a choice between an ABA program that makes use of Skinner's analysis and an ABA program that doesn't make use of it. Those are your choices within the field of behavior analysis related to language. But an important distinction is that people who make use of Skinner's analysis don't just use different terms. Well, I call it requesting, you call it manding. I call it labeling, you just call it tacting. You use kind of fancy words to describe what we all know. That's something that you want to kind of ignore that sort of analysis, because that really is an incorrect analysis. It isn't a matter of just using fancy terms. The word mand and tact and intraverbal mean something different than requesting, labeling, and answering WH questions. They mean something different. And failure to make those distinctions will not allow you to make the distinctions you need to make during teaching, and therefore will be less effective. Those distinctions are important. A mand really is different than an intraverbal. They have different controlling variables. By that I mean they're caused by different environmental events. They are acquired differently. And if you fail to recognize that and just lump them all together as expressive language and just call them requesting, labeling, and answering WH questions, you're going to miss the distinctions and the fine-grained analysis you need to teach children with autism who don't acquire it typically. If you acquire language typically, these distinctions hardly matter. I mean, most of you, my guess would be you learned and acquired language typically. Nobody had a language training program for you. Maybe you had some articulation problems, but most of you probably learned language through everyday life experiences. Well, probably like my parents, your parents couldn't spell intraverbal, no less know what one was. They don't know what if you asked my parents what's an intraverbal, they would have had no idea. What's a mand, a tact? They would have had virtually no idea. But I acquired intraverbals, mands, and tacts, so it seems like, well, it may be unnecessary to use those terms. Well, if you're a typical individual and you come under strict or good stimulus control easily, those distinctions hardly matter, because you're going to acquire language anyway. The same way we're going to teach it here, but you're going to acquire it anyway. However, if you're somebody who doesn't acquire it, the distinction between a manned, attacked, echoic, and intraverbal is very important in the assessment process and in the treatment process. And failure to make those distinctions will probably lead to a less effective outcome. And that's why those distinctions are, in fact, very important. And we'll describe what those distinctions are in a minute. But those distinctions are quite important, and it's not just a matter of it doesn't make any difference. You just use different terms. We're all talking about the same thing. You teach a manned differently than you teach attacked. And if you call both expressive language, you might not know that, and you might not treat those responses differently or teach them differently, and therefore you might only get labels and not get requests, spontaneous language. You might only get echoics and not tacks. Those distinctions are very important. So it's not just, well, you use different terms. Those terms really do mean something, and they are useful. So that is our distinction between ABA programs that make use of it and ABA programs that don't. Of course, I suggest that it would make sense to make use of that analysis in this process. What is a non-behavioral account of language? Which I think I'll just basically give you a very quick overview on. In other words, I just talked about kind of an ABA approach. We use the basic principles, we teach across the categories, all that stuff. Let's now talk about what people who generally think about language, and basically people who really are the largest group of professionals in our area, who, by area I mean in our field, who think about language. How is language conceived of? And I'll just do a brief overview of that. Non-behavioral approaches, and I give you some of the people who are reasonably well known for this sort of thing. Well, they view language as an innate process, a biological process, not an acquired process, although they do look at the environment for some stimulation. But generally, you're born with innate sort of processes that go on in your brain. And if you're not born with them, that's why you're not acquiring language, because you're not processing the information from the world properly. You have some sort of processing issue that is getting in the way of you acquiring the language. And there are mechanisms in which you take in the world, you encode it, and then you code it on the way out through your words to express your ideas and beliefs and feelings. So words are a code for telling people what you're thinking about, what you know about, and it is a way of substituting for your thoughts through a code that allows people to understand. That analysis does not leave you many things to do if somebody doesn't acquire it typically. Because there are, in science we say, there are hardly any independent variables. If you think it's an innate biological process and that process isn't working, then what are the things you do to overcome that? You're not left with a lot of tactics, if you will, that you can do to overcome it. And thankfully, this analysis probably plays a fairly small role in understanding language development. And that's the good news. People who make use of this believe they know the origins of language, where language comes from. It comes from the brain and the processes and the cognitive mechanisms that account for it. So if you already know what causes you to speak, why people say things they do, then what you're interested in is what is it they say. From our perspective, we're much more interested in how do I get somebody to say something, and how did they learn to say it, not what the structure of the language is. I'm more interested in teaching people to do it, not waiting for them to kind of process the information and then describe it. I'm more interested in figuring out how do I get a child who can't ask for anything, to ask for things, not wait until his mechanisms kick in or do some things to try to stimulate his mechanisms and then describe what he does as an evaluation. I'm more interested in evaluating how do I get him to say those things. Much more interested in an outcome related to teaching than I am waiting for him to get the idea on how to talk and then describe it in terms of syntax, grammar, morphemes, lexicon, words that are kept in the head in a place, mean length of utterance. I'm not interested in how many words he says very early on. I'm interested in teaching him how to say those words and how to learn those words in those different categories. So it's a big distinction. It's called a structural analysis. We're talking about a functional analysis. Skinner talked mainly about how does somebody acquire language, not, okay, somebody acquires language, now let's describe it. I'm not interested in how many words he says in a sentence. I'm interested in whether or not he had no mands at all, now he can ask for 20 things to stop his problem behavior, to give him functional skills, to increase his interaction with people. I'm more interested in how to teach that than I am describing what I see. That's the difference in approaches, I think. One, the causes are innate, internal mechanisms versus the environment shapes the verbal behavior. And the second thing is, I'm more interested in how do I get somebody to do it and figure out how to teach him rather than wait for him to do it and then describe it in some sort of way. Those are, I think, some reasonable distinctions between the two. And therefore, we don't make use of the breakdown of just expressive and receptive. In other words, we don't take man's tax, requesting, labeling, answering, and put them in one category called expressive, and then we have another category called receptive, understanding what is said. Give me your socks. Go turn off the TV. Come sit down. Clap your hands. Those are all listener behavior or receptive. We're not interested in those categories. We're more interested in the categories I described earlier, and I'll show you what the advantages of that is. The traditional, and this account that I just gave you probably permeates our field, and many times at IEP meetings, people who take a behavioral approach to language will frequently have difficulties conveying that to other people who don't take that approach, instead take a more developmental sort of approach. It can lead to some disagreements as to what the IEP goals and objectives should be, what kind of way you should start, and those on teaching language. So the summary of non-behavioral analysis of language is presented here, and I'll let you at your leisure kind of read through it. It pretty much summarizes what I just said in a few words, these next few slides, and I think you'll find it helpful. This is a description by Jay Moore, a famous behavior analyst, who describes the non-behavioral approach to language. I think it's a nice description, and spend some time looking at it, just to know the differences in the approaches. Based upon that approach, here's what people who make use of this approach think happens. And then I'm going to show you what I think happens with a behavioral analysis and how to teach skills. Here's what happens if you think of it as a processing sort of issue, a cognitive, innate mechanism sort of issue. Here's what has to happen to talk. A child must formulate the proposition, kind of decide what he wants to say, determine the intent of the message, and anticipate social consequences. This is from a book on the development of language by two fairly well-known traditional sort of theorists on this. Anticipate social consequences, select appropriate words to code the message, organize the relationships of meaning between words, morphosyntactical arrangement, organize the sentence relative to shared prior knowledge, select and sequence the correct phonological and prosodic patterns to express the meaning and intents of utterance, and then execute the motor patterns. Finally, he talks. That's what has to happen. If that's what I'm doing right now, I should be really exhausted. On each word, I should be completely exhausted if every word requires that to occur. And if that, in fact, is what people think happened, tell me what it is you would do with that statement to teach a child with autism who has very little language. Oh, I know how to get him to talk now. You get the point. It just is an explanation of language development that doesn't seem to provide any clear direction as to how you might go about teaching language. Contrasted with a behavioral approach, which we'll talk about in greater detail now. I've talked about some of this already. I'll just briefly review it. This comes from Skinner's 1957 work. He basically said the basic principles: antecedent, behavior, consequence, reinforcement, stimulus control, motivation, extinction. These are at least 5 of the basic principles here: stimulus control, motivation, reinforcement, extinction, punishment. And the word punishment appears there because it's a basic principle. Not that anybody here is recommending using punishment to teach language. It's just a basic principle, so I throw it in there. The word punishment is actually used as the basic principle. It would have been nice if Skinner would have chosen maybe a different term, but who am I to tell Skinner what he should choose for basic, what he should have chosen for basic terms? But in any case, the word punishment means so many things to people. It doesn't mean the same thing in behavior analysis. It means something that happens after behavior that causes it to stop in the future. So in other words, if a child touches his nose and you say, "Good job, way to go," and he doesn't touch his nose anymore, "Good job, way to go" was punishment. You get the idea. It doesn't mean the same thing it means in everyday life. So it gets a little confusing when you use the term because people say, oh, behavior analysis must use a lot of punishment. If you think that's, well, that's not necessarily the case. It just, the choice of word makes people think we do when it doesn't mean the same thing. So it's a little bit confusing. But in any case, we use the basic principles. And language is basically, you're motivated, you want something, you say something, you get something, potentially. Let me show you the definition of verbal behavior. This is a bit of a busy chart, but let me show you what it indicates. Here's nonverbal behavior. I want water, I walk to the refrigerator, and I get water. Motivation, MO, you see that on the left side there. Mechanical operation, I walk to the refrigerator, and I get water. That's basically nonverbal behavior. Not everything is verbal in the world. I'm cold, so I shut a window. I'm warm, so I adjust the thermostat. Those are all nonverbal behaviors. Motivation makes me do something, and I do it. That's not verbal in any sort of way. It's mechanical operation upon the world. But as soon as you involve another person in mediating that, in helping you with that, then your responses become verbal. For example, I want water, and my parent or some listener is there, somebody who understands what I'm saying, and I say, water, and the person gets me water. Delivers water. That's called verbal. Saying water, when I want water, somebody gets it, it's called a demand or request. That's verbal. Now, it's also verbal if I sign water. See, verbal doesn't mean vocal. What I'm engaging in now is vocal verbal behavior. If I was signing, I would be using gestural or sign verbal behavior. Verbal just means getting what you want when it comes to demanding, delivered by somebody else. Skinner used to say, only in the Bible can you yell down the walls of Jericho. Okay? The idea that your words have no impact on anything here. My words have impact on other people. Talking is a social activity. And I'm reinforced by the behavior of other people relative to my word. When I say water, I get water. When I say open, somebody opens something for me. That's what verbal behavior is. It's a behavior that I emit that somebody then reinforces. And I keep saying those words. So those words have no meaning separate from what people do in relation to them. They have only meaning when people respond to them, and as a result produce reinforcement for me, or put them on extinction, meaning they don't reinforce me, or they punish me by giving me a dirty look when I say some words. Then those words get suppressed in that context. That's what language is. It's merely engaging in a behavior called verbal, sign language, whining, crying, kicking, writing, typing, that somebody else responds to. It's not like you can show a note to this table and hope the table will then follow the instructions on the note to get you something. It's only through another person that a note is effective. That's what makes it verbal. Well then, what is my verbal behavior when I'm talking? Is it the sounds I'm making? Your verbal behavior is not the sounds. The sounds are the product of your verbal behavior. What is my verbal behavior? It's the movements of the muscles and bones of the vocal apparatus that produce sounds. So when somebody says, I taught him to say cup, and now I've increased his verbal behavior, what have you really increased? You've increased the movements of the muscles necessary to produce a sound cup that other people understand. The sounds are not your behavior. How could sounds be behavior? Sounds are not influenced by reinforcement. In other words, if I clap my hand like that and make that sound, could I then say, good clapping, and that sound will occur again? Because the sound, in some way, that behave. No, what gets reinforced is the movement of my muscles that produce that sound. That's what gets strengthened, not the sound. It's the movements. So when I sign, what is it that gets strengthened? The movements of the arms and the gestural movements that get strengthened by reinforcement. Sounds are not verbal behavior, they're the products of your verbal behavior. What you're doing is shaping up movements. That's what behavior analysis talks about. How do I get people to do certain things certain ways? You're getting somebody to do something, and talking is doing. Talking is behaving. It's behavior just like clapping your hands, getting dressed, learning toileting, learning to wash your face. It's just another repertoire of behavior. It's just hard to teach. And some people don't acquire it very easily. But it's just another form, and I say but, and I don't mean that in a minimalistic sort of way. but I mean it to say it's another form of behavior that has to be taught. So if I can teach him to clap his hands, I can teach him the toilet, I can teach him to dress himself, maybe I can also teach him to talk. This is another repertoire of behavior, just a different repertoire. That's what we're taught. That's why we say language is behavior, not some mental cognitive process. It's more behavior to be taught. It doesn't explain behavior. It's more behavior to be explained and to be taught. I hope that is clear. What Skinner suggested, after much experimentation, was that he had uncovered some natural laws about language that not only include reinforcement, extinction, those basic laws. He found some things unique about verbal behavior that's different than some other behaviors. That the behavior develops in categories. Nature had decided that, however you think about nature. The world evolved to produce verbal behavior this way, with nobody designing it unless you think of nature in a more designed sort of orientation. He said there are categories of verbal behavior. And he said, I'll give those categories names. They are the mand, the tact, the echoic, and the intraverbal. The four basic elements of verbal behavior that generally occur in the first 3 years of life, that get developed very quickly in the first 3 years of life. And he said each one of them is actually separate from the other. In other words, if somebody learns a mand, which is best described as requesting. I'm motivated for something. I command, demand. I want something. If a child learns to man for things, and he can say cup when he wants it, he discovered when somebody would show him the cup and say, what is it? The child couldn't say cup as a label. He could only say cup under the conditions in which he wanted it. So he learned it only as a mand. That occurs with typically developing children, but it breaks down more easily where you get crossing over these categories. In children with developmental disabilities, what we know is if you teach somebody tacts, labels, and that word came from contact the environment. In other words, I hold this up and say, what is it? You say pen. What's that? Cup. I smell pizza. That's a tact. I hear a bird chirping. That's a tact. Anytime your senses contact the environment, you're tacting. That's where the word came from, contact. Anytime the physical environment influences you, you name it. Well, if you teach a child hundreds of those at 5 years old, hundreds of labels, when you're done, you probably will have very few mands and no answers to WH questions, interverbals. You'll have tacts. So a program for children with autism that focuses on one of these categories and not the others, and to the exclusion of the other, will have somebody who will learn only one category and will not have a functional language repertoire. That's a problem. And failure to understand that, because you've lumped them all together as expressive language, that's the distinction I was talking about earlier, fail to distinguish between a mand, a tact, echoic, and intraverbal will lead you to less effective outcome. Because now you've got a lot of tacts, and he never uses any, he can say cup when he sees one, but when he wants a cup, he'll never say cup. And parents say, well, that must be because he just can't understand. He doesn't have the cognitive ability to understand how that's a cup also. No, it's because they're functionally independent. He's being governed by the natural laws of the world that basically indicate that you're not going to learn it unless you're taught it. Now, typical children learn those transfers a little bit more easily. And that's why your parents didn't sit around saying, well, how many tacts has Vince got? I hope he's got enough mans. We better be working on the man. That's why your parents didn't need to do that, because everyday life programs all of that. Well, everyday life programs it for children with autism, but if you don't learn very easily, you can see how you're going to learn in one category in which you're taught, and all the rest of them are not going to be there, and you're not going to have functional language, and as a result, the child's going to be blamed for having limited skills, when in fact it may be a teaching problem. My parents didn't know what man training was all about, but I learned a large enough manned repertoire to be thrown out of Catholic school by 3rd grade. In other words, in the 1950s in New York City, at St. Gerard's School, if you asked a lot of questions, you were generally punished for doing so, okay? So I would ask a lot of questions, and as a result, I was dismissed. And they thought they were punishing me by throwing me out. Actually, it was a reinforcer. So I kept asking a lot of questions. It actually increased my question asking. since good things always happen after I did it. But in any case, you get the idea that I developed a large man repertoire, but nobody sat around teaching me a man repertoire. Well, they did. They just didn't know they were. Okay? So it may not matter, these distinctions, but they matter greatly. In other words, mans are words you say because you're motivated for something. Tacks and labels are things you say because you see those things, touch those things, smell those things, taste those things in the environment. Your senses contact them. And intraverbals are words you say because somebody else has said something. What do you like to eat for breakfast? Pancakes. Well, you notice I'm not motivated for pancakes right now. I don't see pancakes. I'm saying pancakes because I heard somebody else say, what do you like to eat for breakfast? Somebody else's words made me say that. Well, here's how typical development goes. You first start to, in the first year of life, man a lot. You cry, you scream. Parents will even tell you by 3 or 4 months, they can tell when their child's sounds are because they're happy, because they're hurt, because they're hungry, because they want attention. They can tell the difference, and you start to make different sounds for different MOs, motivation. The repertoire starts to get differentiated in the first year. So you make sounds to get things, you point at things, you guide people, you have eye gaze. You probably have very few words in the first year of life, but you have a large manding repertoire, and that's how you control your caregiver. It's verbal behavior. It's not vocal verbal behavior because it doesn't have the sounds of the language. In American English is what we're talking about now. But it's verbal still because it's mediated. You cry this way, you get fed. You cry this way, you get picked up. You cry this way, you get your diaper changed. All of those are verbal responses. And it's a dance between a parent, a caregiver, and a child, and they begin to learn. They point at things, they get things. All of that develops. At the same time, you're beginning to hear what people are saying, and after about 6 months or so, you're starting to echo what other people say. The sounds of other people start to sound good to you. You like hearing what other people have said. So if parents are talking to children while they are caressing them, while they are comforting, while they're caring for them, those words start to be fun to hear, and that's why children start to echo the sounds of the language they're immersed in, because they like hearing the sounds of other people, because they're always correlated with reinforcement. So now the child starts to develop an echo. At about a year old, the echo gets strong enough so that the things you want, you can now echo a little bit. You've heard people say water, water, water. You can now echo a little bit. When people have said water, you've received, oh, you can have some water. Here, you want some water. Here, you want some water. Here, you want some water. Well, every time I say that, I get water. Now the MO, you're thirsty, and the MO for water kicks in. Now you say wah-wah, and the parents, oh, yeah, sure, you can have the water. Well, you can see if you've got a little bit of an echo, the parent said water, you say wah-wah, you get it. What will you do maybe next time you're thirsty? You won't need the parent to say water. You'll just say, well, that's how it will develop. So now your man starts to occur. The man repertoire occurs at about a year old vocally. Then your echo continues to develop. You get better at controlling the vocal musculature and you can echo better. What happens between 1 and 2 years old? Your tact repertoire, your man repertoire starts to get better. Your articulation gets better, your articulation. And between 1 year and 2 years old, you develop lots of mans vocally and lots of tacts. You start to now name things in the environment because when you do, people say things to you. You look over at something and you say, ball. Not because you want the ball, you just see it. And the parent says, oh yeah, that is a ball. That's right. Now the child is under the control of social reinforcement. Now he starts to tack things. Why? Because people reinforce you when you do. They say things. It's behavior. Now you develop a lot of tacks. By about 2.5 years old, you have hundreds of tacks. You have lots of mans, and you're echoing better and better. Now what starts to develop? Now I not only care about my motivation, I not only care about things in the environment, I now care about what other people are saying. And now I learn to behave intraverbally. I start to learn to respond to what other people say. You'd like to drink some water, wah-wah. Now that response water not only is a man, not only is attacked when I see it, but now is a response to somebody saying, what is it you like to drink? Now I can say, well, water. Your intraverbal repertoire. Your intraverbal repertoire is a very important repertoire. It doesn't develop very well without a large echoing repertoire, a large manding repertoire, a large tacting repertoire, and a large listener repertoire. Because at the same time, on the left side of the screen, your nonverbal listener behavior is developing as well, from birth on. You're starting to understand what people say, and you're starting to do the things that people say, selecting things, following instructions, and so on. And all of these are taught through everyday life experiences by people who have no idea that they're teaching these things. If you play with your children, you do good things with them, you enjoy them, you reinforce, you use social activities, you play with toys, you interact, all of this happens through imprecise teaching. All of this will happen with no program teaching or awareness on the part of the parent or caregiver. However, if we're talking about a child with autism who doesn't learn very easily, if you don't know what happened in typical development to develop this, you're going to have a hard time teaching a child with autism who doesn't acquire this typically to acquire these skills, because you're unaware of what it looks like magic when somebody's 3 years old and talking in full sentences, having conversations. Like, how did that happen? I mean, you just talk to him, and suddenly he's talking, and he's saying all kinds of things, and what did I do to make that happen? That's why people think, well, it must be some processing in the brain that occurred, some magical process that happened, because I didn't think I did anything other than just play with him a little bit for the last 3 years, and he can talk. Well, there was a lot of things going on, and there have been several studies, longitudinal studies, of people who have looked at what parents do over the course of the first 3 years, and there is a ton of what I'm going to describe on how to teach in just a minute going on. There's a ton of it going on completely accidentally that accounts for it. Because some people have said, well, if it's magic, then it must be something in the brain that happens. And people have looked at parents working with kids over many years who didn't know anything about teaching language, whose kids became good talkers. They analyzed it and found out they were teaching MANs, they would differentially teach tags, they were teaching intraverbals, they were teaching echoics, they were differentially reinforcing, they were prompting, they were fading, they were doing all the things I'm going to show you to do to get this in a child with autism who doesn't get it typically. They were doing all of those things. They just were unaware of it. Good parenting just includes that repertoire. Makes sense. Something like that must be going on. These are the 4 primary categories that Skinner talked about. And these are the categories we're going to talk about today and analyze how you teach each one of those in order to begin the process of getting somebody who has very limited language skills to have more advanced language skills. The MAND, requesting, the TACT repertoire, labeling, the echoic repertoire, imitating sounds, and the intraverbal repertoire, and then, of course, the listener repertoire, which occurs simultaneously with the teaching of the rest of these. These are the 4 major primary. Now, there's some secondary categories, too. If we have time, we'll talk about that. We may not have time to discuss that. But these are the 4 primary categories. And now what we'll do is start to look at what each of these look like. I'm first going to describe what each of them look like and show you videos of each. Then what I'm going to do is show you the teaching procedures for each one of these. So first I'll show you what they look like, then I'll show you the teaching procedures for each one of them in a child who is not acquiring these skills. Okay? Any questions? This is a good point to take any questions you might have. No? Okay. Well, then let's take a look at each of these categories. The first one we're going to talk about is manding. Demand, command, made-up word by Skinner. What Skinner uncovered was the fact that when you're motivated for something, notice you see that over there on the left side, antecedent, motivation, learner behavior, verbal, MO, motivation for candy, learner says candy, deliver candy. Let me show you an example of this with a child with autism, not the teaching procedure, but just what it looks like, and then we'll talk about the teaching procedure for it. Man, for those who can't see the videos, it's a child playing with toys, playing with a barnyard activity where he's going to man for cow and a tractor and other sorts of things. And you'll hear the child manding. Notice manding are spontaneous. They are initiated by the child. It's important to get initiations early on. Motivation brings out these responses. Now, to teach them, there's a prompting procedure, which I'll show you later on. In other words, how did he come to say cow? Did it just magically happen? No, we prompted the word cow. He could echo it, and then we faded our prompt out, and this is what it looks like once you faded the prompt out. He now knows what to say. But I'm going to show you those teaching procedures later. I want you to just see each operant. When I say operant, each class, each response class, man, tact, those are operants. Man, tact, echoic, intraverbal. Tractor. With sign language. The boy who wanted Brian to send the car down, and he signed car. That was an example of sign language. Why would we be using sign language? Mainly because he's non-vocal. What do I mean by that? He can't produce the word car for whatever reason. He's about 5 years old. He produces very few words, so we've got to give him a way to communicate. We've got to give him some verbal behavior, so we'll use gestures to do it, the same way that people who have hearing impairments and deafness also make use of sign language as a gestural system. Notice the response product with sign language is visual. The response product with vocal responding, obviously, is auditory, okay? So this is visual. It's obvious that the people he's speaking to need a visual product, not for people who are deaf. Obviously not for him, except that it helps to facilitate the teaching. So it's not the same as teaching somebody who is deaf to sign, but it has some of the advantages that you get from sign language. Let's look at the tact now. The child sees something, says something, and doesn't get the item, he gets an attaboy. Way to go, good job, that's right. A lot of reinforcement is of that sort. When a young child says ball, and the parent says, oh yeah, that is a ball, that's the reinforcer. A lot of people think that saying, oh yeah, that is a ball, isn't a reinforcer. Well, if you're motivated by social attention, that's the reinforcer. It's not like you have to be, okay, give him 2 tokens, good job, nice saying ball, you get 2 tokens and a piece of candy. People think that's what reinforcement is. Well, in everyday life, when somebody says, yeah, you're right, I hadn't thought about that, that's a reinforcer for what you just said. For most people who are controlled by social attention, that may act as a form of reinforcement. Or if you're reinforced by irritating people, which has a diagnostic category you could be placed in, but if you're reinforced by irritating people, signs of irritation could act as a reinforcer. Reinforcers in everyday life are not, oh, good job, you get a piece of candy, way to go. They're the reactions of other people. A simple look, a nod of the head, a smile, a frown, all act as forms of reinforcement and control a lot of verbal behavior from moment to moment. So while I'm showing these examples of it, just know in everyday life the reinforcers are different, but we have to make them clear and obvious and highly motivating for children with autism because they don't come under the control of raising an eyebrow as a warning to stop that. In church, just a raise of the eyebrow would be enough to quiet some typical children. It would have no effect on a child with autism who might not come under the social control of subtle sort of changes. It's that sort of idea. So you've got to use strong, particularly strong reinforcers. So let's look at the labeling, tacting. Somebody holding up a picture during discrete trial and instruction saying, what is it? And the child says, car, when he sees the picture. A label. It could be a smell, it could be a sound. Somebody puts sugar on your tongue and says, how does that taste? And you say sweet. That's a tact. It's a gustatory tact. You smell something, what do you smell? Pizza, that's an olfactory tact. Anytime your senses contact the environment and you give it a name, you label it, that's called tacting. That repertoire usually begins to develop at about a year old and develops for the rest of your life. You learn new tacts. By 3 years old, you have hundreds of those, and sometimes into the thousands of tacts. You have names for almost everything that you come in contact with. Let's look at sign tacting. The picture said, "What is it?" And she signed rhinoceros. It's a little rhinoceros toy she likes to play with. We've taught it as a mand. Now we're teaching it also as a tact, sign language as an alternative. Why? Because Katie, if you tried to get her to echo rhino, she couldn't do it. But we've got to give her a way to do that in the same way that somebody who's hearing impaired can't do it, but for a different reason. They can't hear it. Anything you can't hear, you can't easily echo. And in this particular case, it's not a hearing problem. For whatever reason, her vocal apparatus doesn't easily learn echoic responses, probably related to her neurobiological condition called autism. But her neurobiological condition with autism can be overcome somewhat by effective teaching, and that's what we're attempting to do. Okay, let's take a look at echoing, being able to say the sounds that somebody else said. I say candy, you say candy, and I say way to go. Let's take a look at this. Develops generally in the first year of life and then continues for many years afterwards. It's not until you're 5, 6, 7 years old that you can say all the sounds in American English in all the different positions. It usually takes until almost 7 years old before you can produce all the, but you're very intelligible. People know what you're saying clearly before you're 7. So it really doesn't matter all that much.
Me.
And now it gets reinforced with a piece of candy. Why use candy? Well, it's a very strong reinforcer for Maddie, and it's a hard response. The harder the response, the stronger the reinforcer needs to be. Of course, you would rather use social reinforcement, good job, way to go, a smile, but if the child is not under the control of that, and in fact that is one of the diagnostic characteristics of children with autism, is that social attention doesn't act as a reinforcer. That's why you don't get joint attention early. That's why joint attention is a marker very early on of a developmental disorder potentially, is if social attention doesn't act as a reinforcer, you don't go to a zoo and say, there's an elephant. You don't point out things in the environment that are interesting, because the reinforcer for saying there's an elephant is not that you get an elephant. You don't get a better view of the elephant. You get somebody reacting to what you say. And if somebody reacting to what you say doesn't matter to you, you're interested in the elephant, but why would you tell anybody else about it? You get the idea? So if social attention is not a reinforcer, you may have to use other things that are reinforcers that you might think, well, I wish I didn't have to use, but you may have to in order to get strong reinforcement in place. Let's now take a look at motor imitation. I do something, teacher does something. Echoing without talking. I'm going to do the same thing you do, but I'm going to do it in a motor way. I'm not going to do it in an echo. I'm not going to do it vocally. I'm going to use some other motor gesture in order to produce the same thing. We call that mimetic. It's a convenient term that Mark Sundberg made up. And it's helpful, I think, in describing it. Intraverbal behavior. Responding to what other people say. This is your intellectual repertoire. This is the repertoire that when you go to school, that you spend most of your time being assessed on. People want to know about your intraverbal repertoire. By the time you're 5, 6 years old, nobody really cares that much about your tact repertoire anymore. They certainly don't care about your mand repertoire. In fact, your mand repertoire will get you thrown out of classrooms as opposed to reinforced if you ask too many questions. And nobody really cares that much about your tact repertoire in typical kids. They figure by that time you've got a good echoic repertoire as well and listener repertoire. But it's your intraverbal repertoire that you go to school to improve. Most of what you learn in school is intraverbals. Tell me about Baroque art. And now if you can say a lot of things about Baroque art, that's an intraverbal repertoire. Those are all intraverbals. Pretty much your intellectual repertoire is your intraverbal repertoire, and it's a very important repertoire. It tends not to develop very easily in children with autism. Generally, it requires a large mand, a very large tact repertoire, and a very large listener repertoire before it will develop. It develops typically at about 2.5 to 3 years old, is when the intraverbal really starts to occur. So here's the sequence. I first learned to talk because I have an MO, I'm motivated, my first year of life. My second year of life, I learned to say other things as labels because I'm now interested in the environment, tacting. And then at about 2.5 years old, I'm now interested in talking in response to what other people say. That's the sequence of language development. I learn to talk because I'm motivated. I learn to talk because I'm interested in the environment, and I talk about things in the environment. Then I start to talk because other people talk. That's pretty much the progression, and the teaching ought to progress that way. This is your intraverbal repertoire, a very important repertoire. It's your intellectual repertoire. Well, let's take a look at some examples of it. Simple examples of intraverbal responding. Trial instruction, tell me an animal. And he says dog. Notice there was no dog present. If there was a dog present, it would have been it begins with a T. Tact, good. A little errorless teaching here. We'll make it as easy as possible, okay? If he wanted the dog, then the word dog would have been a mand. But instead, it was just responding to what she said. That's what makes it intraverbal behavior. These are naturally occurring categories. And what's interesting is that if you teach in any one of the categories exclusively with children with autism, you will get only that category in most cases. So if you teach all tacts because you think he needs a vocabulary, what is it, what is it, what is it? When you're done, you'll have hundreds of labels, and it won't use them for mands, and he won't be able to speak intraverbally, which will make him non-functional. Because if all you had was a tact repertoire, most of your day would not be saying much. Because what's required for a tact repertoire? Somebody usually wants you to tact. They usually say, hey, what's that? You don't walk around tacting. What if you walked into a room and said ceiling, floor, chair, cup, computer? You wouldn't attract a lot of people. Well, you'd attract a lot of looks at you, but you wouldn't attract a lot of people who said, well, I think I'll spend a little time talking with him. Probably not going to happen. So when you have a tact, if all you had was a tact repertoire and you spontaneously admitted it, the only time I say computer is when somebody says, hey, what is that thing? Then I might say computer. I might. What kind of computer is that? Well, it's a Sony. I might say that. Well, you get the idea. Your tact repertoire isn't something that you just walk around saying. So if you teach somebody a lot of tacts and they've got all these tacts, you will probably have almost no functional language because you haven't taught mands, you haven't taught intraverbals. That's why it is so important to assess using the VB map in terms of which category are the deficits and then teach across the categories so that you build these categories and not just teach in any one category because you think, well, first he's got to know the name of it before he can ask for it. No, he's got to be motivated for it and I'll get him to ask for it, but then I've got to also teach him when he's not motivated to tact it. They're different categories. And they are acquired separately, and in children with autism, they're very restricted, and failure to recognize that will lead to major problems in acquiring language. Yeah, one second. Let me finish up this point here. Yeah. Take a look at another. Here's a sign intraverbal. Say, Play-Doh is something it's hard to understand her. She's actually speaking English, and she says she's speaking the real English. But in any case, she's also speaking fast, and the video is not very good. But she's going to say, Play-Doh is something and he's going to sign play with. It's Macaton sign. We would go play like this, but it's Macaton sign, which is the sign that's frequently used in the United Kingdom. This is a school we consult to in London. Okay, so listen to it. She's going to say, Play-Doh is something and he's going to say Play-Doh with sign, which is an intraverbal.
I tell you something.
And he wants a big grape. That's a sign for grapes, and he wants a big one as well. Look at the smile on his face. Very satisfied with the idea that he'll be getting a big grape any minute. Here's some quirky introverbal behavior. This is a typically developing child. This is my grandson. So I make use of, I've been he's about 3.5 now, and I video him all the time so I can get examples of typical development across the operant categories. One of the things I did with him at about 7, 8 months is I started to teach him extensively sign language in order to facilitate his development of language. It's a good thing with typical kids as well as kids with autism who may need it. So this is before he could talk. This is introverbal behavior, but it's kind of quirky introverbal behavior in that I'm going to say things like, sign book, and he's going to go like this. That's actually introverbal behavior. It's translation. If somebody was standing right here next to me and was signing everything I said, as you might see in some programs, what is their behavior, the signer who's translating? That's all introverbal behavior. They're responding to what I say with different form. That's introverbal. They're not manding. They're not tacting. There's no physical item that I'm showing. They are engaging in introverbal behavior. So watch quirky introverbal behavior. Quirky in the sense it just doesn't match it, but it's a good indication of the development of skills. So here he is, and I'm kind of, he was getting ready to eat a little bit, and I said, well, let me go through some sites. About, I don't know, 10, 11 months here, and I've probably been working with him a couple of months now at this point to teach him signs.
Kelly. Sign.
His name is Kelly.
Cookie. Good. Sign lion.
Lion is like this, you know, the mane of a lion.
Sign. Sign book. Book. Sign.
There's a little vocalization with it as well. One of the advantages of sign language is it may bring some vocal production, okay? But these are all actual introverbals.
Elephant. Show me elephant.
Elephant is like that, you know, you kind of make the sound of an elephant and you don't have to make the sound, of course, but you kind of, the trunk of the elephant, that's what he's doing, there.
Show me more.
You would not want to teach that to children with autism early on because everything would become more. But with typical children, more occurs fairly early on and there's no problem in teaching it early.
Show me dog. Dog.
He's trying to tap his leg, which is the sign for, for dog, like come here. Yeah.
Oh, yeah, that's right. Show me horse. Oh, yeah.
Horse is kind of like that. Yeah, kind of like that right there.
That's a horse. Show me cookie. Show me cookie. Cookie. There it is.
It's a quirky introverbal.
Apple. Yeah.
Can develop this way as well. Kind of funny story related to this. About this same time, we've been teaching him all these, that was his mother in the background as well. We've been teaching him all these signs, and he came out of a doctor's appointment one day, and a man walked out at the same time who was very big, you know where this is going, had long hair and a big beard. And he looked at him, pointed at him, and signed bear. We were thankful he couldn't talk yet. That would have been a little bit embarrassing. His mother was thankful for that. But you can see sign language can be a useful repertoire to teach. Your introverbal repertoire is what makes you interesting as well. And it's an important repertoire. And it's almost never taught in children with autism because it's thought they can't understand it, they can't do it, they don't acquire it easily, or people try to teach it too early. The child hardly has any labels, tacks, and now they're trying to teach introverbals. Well, you see, it doesn't make much sense to talk about things before you know what they are. Something that says meow is and now you say cat. Well, you could teach a child with autism at 10 months, 14 months maybe, with sign language to say that. But then you ask them, what's this? And show them a picture of a cat, and they don't know what it is. Well, you get the idea. Talking about what a cat does as an intraverbal makes no sense until you know what a cat is as a tact. You see, and as a selection, give me the cat, show me the cat, point to the cat. You get the idea. So that's why the intraverbal doesn't develop until you have lots of listener and tacts, hundreds, in fact, of those responses, before you ever learn the intraverbal, because intraverbal is talking about the things you can already tact. And it makes sense to be able to tact them, select them before you ever do that. What makes you interesting. If you go to a party and you're thinking about the people you might meet at a party, I bet you almost never say this to yourself. Boy, I hope I meet somebody there who really is very good at manding. I hope I meet a good mander. Somebody who annoys me all night long to get them things. Mind getting me a cocktail? Well, how about an hors d'oeuvre? Would you mind getting that for me? You got $5, I'm a little broke. Nobody thinks, boy, I'd like to meet some good manders. Or, you know, I'd really like to go to a party, and I hope this person can tact everything in the room. Wouldn't that be interesting? They could label everything. What an interesting sort of discussion we would have. You don't care about that either. What do you care about? I hope I can talk to somebody about things that are interesting to me, and they have interesting things to say back. That's called intraverbal behavior, cocktail chatter. I'd like to talk to somebody about some interesting topic, things we share in common, things I might learn about, things I'm interested in, and things they're interested in. That's called intraverbal behavior. That's what you're hoping for. When you go to a cocktail party, it's all intraverbal behavior. There's almost no tacts, and maybe an occasional mand. Would you mind passing the napkin over here or something like that? But there's almost no echoing. You almost never say exactly what the person said. You don't say, boy, I wish I meet somebody who can echo everything I say. Wouldn't that be an interesting person to spend time with? Well, of course you don't think that's particularly interesting. Yeah. So it's the intraverbal repertoire that makes you interesting, that people judge you on is your intraverbal repertoire. So it's a very important repertoire. Responding to what other people say is most of your social life. And not all of it, but you must have listener, manding, and tacting before you're going to get intraverbal. Those have to be foundations that you have to have before that repertoire will ever develop into a sophisticated sort of repertoire. So it's a very important repertoire. Take a look at listener behavior, another very important one. Here's listener behavior. Clap your hands. Just responding to what somebody says. Close the door. Would you mind shutting the window? Would you mind making it warmer in here? Those kind of things. Listener behavior selection. Give me the.
Vincent, give me the apple.
Would you mind giving me a cup of coffee? Mind giving me a cup? Those are all, you're responding as a listener. Somebody else is talking and you're responding to them without any verbal behavior. You're just following that's all listener behavior. Very important repertoire of behavior to acquire. And it all can be taught, but it's not verbal. It needs no special analysis, is the way Skinner talked about it. It's merely responding under what Skinner called discriminative control, meaning you're merely responding to the words somebody says differently. Different words, you do different things. Discriminative, that's what it means, discriminating, responding differently to different things. That's all that is. And it's an important repertoire. It typically is acquired more easily because it requires no production on your part, so to speak. You're merely responding with behaviors that you can engage in easily. You can walk, you can grab things, you can open things, you can find things, you can see things. So you've got all the prerequisites for listener behavior. There's no production necessary other than producing responses that are already well developed in your repertoire. So listener behavior is acquired fairly easily, fairly quickly, and generally at a faster rate than most speaker behavior in almost every. You know plenty of people who can read a language, listen to it, and understand it, but can't speak it. You may be somebody like that. I spent some time in Italy, and I can generally understand what they're saying. I can't produce the responses back intraverbally, but I can generally understand. I can read it reasonably, reasonably well, somewhat. So you get the idea. Listener by feature, function, and class. This is another listener. skills, which is different than give me the bus. So you learn to respond to what people say with motor behavior. You learn to respond to select things with motor behavior, and you learn to select things based upon what people say. Somebody might say, hey, while you're up, would you mind getting me something to drink? Which is different than getting me some soda, but getting me something to drink. That's kind of listener by fee. There's not a lot of that. When you're up, get me something to write, or would you mind giving me something to write with? Yeah, but rarely do you say things like, would you mind passing the item that makes my food a little tastier? You almost never say that, okay? If you do, then there's a diagnostic category for you as well, okay? So it's unlikely you're going to say that, but you'll say pass the salt. So you don't hear that a lot, but it is part of everyday life. However, it's valuable for teaching children with autism because by teaching that, you may get to intraverbals that way. That may facilitate intraverbal behavior. Here's the general rule that summarizes everything we just talked about. If you want to teach somebody the meaning of what they're saying, to understand what they're saying, the meanings, then the word candy, which sits in the middle there, you're going to have to emit the word candy as a mand, emit it as a tact under the right conditions. In other words, you can mand for candy when you want it. You can tact all forms of candy when you see them. You can echo the word candy. When somebody talks about candy, you can respond candy, something sweet that you like to eat, you can say candy. When somebody says, hey, would you mind getting me a piece of candy? You can discriminate among the items of food on a table which one is candy. Mimetic is only if you're signing. So if you want to teach somebody what it means to understand the concept of candy, it means they can man, tact, echoic, engage in intraverbal behavior and listener behavior. That's why you have to understand that these categories are separate and have to be taught differently. If you want to teach the man for candy, you teach it differently than the tact for candy. And if you fail to teach the tact for candy differently than the man for candy, then you won't get the tact, and as a result, you won't get a full understanding of the concept of what candy is. All of these responses are necessary for somebody to make before you say they understand what they're talking about. And that's why you can teach intraverbal behavior and get kids to say almost anything intraverbally. Tell me something you wear on your feet for protection. Okay? And the person says, shoes. I can teach somebody to do that who has an echoic repertoire in a few trials. But do they understand feet, shoes, protect? In other words, they can't tact or man for protection. They can't tact or man feet. They can't do any of those things, but they've got the intraverbal. And wouldn't you say that's somebody who doesn't really understand what they're saying? Well, sure, that's the case. That's because they don't have the other repertoires. That's why you have to teach all of the meanings for every word. And sometimes you get some freebies. Sometimes you teach the tact, you get the man. Sometimes you teach the man, you get the tact. But you don't know that unless you assess for that. If you lump them all together as expressive language, you never test for the man separate from the tact, separate from the echoic, separate from the intraverbal, separate from the well, you might do it separate from the listener. But you wouldn't do it in those four categories. And if you don't test separately, you don't know what you have. And as a result, you're going to be teaching completely blind to what it is this child needs across all these categories. Now, why do these categories exist? Because nature decided, not Skinner, that they would exist. I mean, it's the same thing. Who decided gravity would exist and that we should obey it in order to put a rocket on the moon? If you don't obey gravity, you're not going to put a rocket on the moon, that's for sure, okay? And along with a lot of other physical, natural laws. You don't obey these laws, you're just probably not going to get a very good outcome. How do we know these are laws? There have been hundreds and thousands of experiments to verify these as basic principles and laws of behavior. We know they exist as laws: reinforcement, extinction, stimulus, control, motivation. And there have been less studies that have shown, but still shown, that the mand is different than the tact, which is different than the intraverbal, which is different than the receptive. There haven't been hundreds of thousands in that area, but there have been enough to be convincing that they really are different. But the basic principles that guide our life and our behavior, those are well established scientifically, there's no refuting reinforcement does exactly what it says it does, which means it occurs after behavior and it strengthens any behavior the consequence is reinforcement will strengthen any behavior that produces it. That's pretty clear. And so are these others, laws related to these issues. Okay, before we take a break, I'm going to have you do a little quiz. I'm not going to call on anybody. I'm just going to ask you to respond to some of these things, okay? Just to see how you're doing if you got these general categories. Then after we take a break, we'll come back and we'll go through the teaching of each one of these skills, okay? Now that you understand what they are, you've seen them, we'll talk about the man, the tact, the echoic, the intraverbal, the listener response, and we'll go through teaching procedures for each one of them. Child says candy because he wants some. Candy is a man. Good. Notice you said that pretty loud with a short latency. In other words, pretty quick. Watch that change, okay? Which suggests the strength of your repertoire. You ever find yourself when you're not sure, it takes you a while and you say it very low? You answer very weakly? It talks about the strength, so the strength will change here. Child signs ball when he sees one. Tact, good. Child touches the cup when teacher says, touch the cup. Listener, good. Child says eat when she is hungry. Longer latency, notice it was manned. It was whispered. Yeah, it's a man. Child says red when teacher says, tell me a color. Intraverbal, right, responding to what other people say. Child gives an apple when the teacher says, give me something that is red. What? Listener response. Listener by feature function in class, but listener response, right. Child hits the teacher when he wants his attention. Manned, right. A lot of problem behavior are actually mands. Child signs move to parent when she is blocking sight of the TV. Manned, right. Child says up after teacher says up. Child says blue when teacher says red. There's a weak response. Child says blue when teacher says red. I say up, you say down. I say my country 'tis of, and you say thee. Yeah, it's intraverbal behavior. I say something, you say. I say red, you say blue. I say up, you say down. I say go, you say stop. Those are all kind of, I say what'd you have for breakfast, you say pancakes. You see, intraverbals are like word associations. Some verbal stimulus evokes some verbal response. They're associated in some sort of way. And a lot of early teaching of intraverbals is songs and fill-ins. And that's why a lot of nursery school, 3 to 5-year-old children, preschool, why do they spend so much time on nursery rhymes, on songs? Humpty Dumpty sat on the wall. Humpty Dumpty had a great, and the children fill in fall. Those are all intraverbals. And what's characteristic of 3 to 5-year-old children? They have weak intraverbals. All those nursery rhymes and songs are all designed, children on the bus. Those are all designed to teach intraverbal behavior, to get kids to respond intraverbally when they can tact. And that's why the books are always full of pictures, because they already have tacts, and now it will support their intraverbal responses. And that's why they do a lot of pictured discussions, because the pictures support the intraverbal, which is weak, but if I've got the tact, I could probably fill it in and use the tact to transfer to the intraverbal. That's what preschool teachers are doing, unwittingly, in most cases. I bet their lesson plans don't say, well, I'm providing tact stimulation to evoke intraverbals. I dare say they almost never say that. And if they did, they would probably be better at teaching it. But the fact is that they do it does lead to intraverbal behavior. Those are all intraverbal activities. Child says go away when the teacher sees, child says go away when she sees teacher coming. Child says what's that when he sees a corkscrew. Intraverbal. Let me back up. What's that when he sees a corkscrew? Yeah, it's a man. What is it a man for? Yeah, it's a man for information. It's a man for information. And that is an example of manding. Child says dog when you, child signs dog when you sign dog. Mimetic, yeah. Child touches the kangaroo when the teacher says touch the marsupial. Now you have to know what a marsupial is in order to get this, so Child touches, it just touches, no, just motor behavior, not verbal behavior. Yeah, listener by feature, function, or class, in this case, a class of mammals, right? Child says dog when he hears a dog barking outside. Tact. Child asks, how are you when he meets you? Manned, right. Nobody has said anything. It kind of looks like a manned. And I think, you could say it was a man. How are you? And you're waiting for information. But when you're passing a colleague here in the hallway, and you haven't seen maybe that day, somebody you know reasonably well, and you're walking by, you're off to a meeting, they're off to a meeting, you say, hi, how are you? And you just kind of keep going. Do you really have an MO to get into a long discussion about their well-being? Well, if you don't mind stopping, I'd like to talk to you about all my problems. You just asked, how are you? You must be interested. Let me talk about my problems. Well, I've got my own problems. Let me move on, okay? You get the idea that... So there really isn't an MO, is there? I mean, you're not really... Now, if you see a friend who just got out of a hospital, for example, and you see them, you might say, how are you? I mean, you really kind of mean it because you want to know how they're doing. But when you're doing... So it looks like a man, and in fact, you purposely dress it up to look like a man. You make it look like a man because it's better than a tact. What you're really doing is tacting and acknowledging they're there. Because it would be awkward not to. The reason why you do it isn't because you care what they have to say about how they're doing. It would be awkward to just walk by and not acknowledge their presence. So next time when you're in the hallway, here's what I say you do. You just do something like this. I noticed you're there, and just keep walking. It's the same thing. It's not any different when you come right down to it. There's a dark side to our lives that never really gets talked about as it relates to verbal behavior. There's always a darker side that almost never gets talked about, but that's your real motivation. It would be uncomfortable to walk past somebody you know and not at least acknowledge them, so you do it, but what you're really doing is merely tacting their presence, not really manding for information. But you dress it up to look like a man because it's more socially appropriate than tacting. Child says yes when you hold up a pen and ask, is this a pen? Part introverbal, because you're responding to what somebody says, but it's mainly tact. Is this a pen? They say yes. Yes is short for what? Yes, that is a pen. It's short for saying pen, yes. Child says yes when you ask, do you like to play baseball? Introverbal, right. And child says salty when chewing a potato chip. Tact, yeah, tact, very good. Okay. Couple more things on this, but let's take a break for 15 minutes. I'll see you about 3 o'clock, and we'll come back.
Forgot to announce this at the beginning, my apologies. Please make sure that your cell phones are turned off. We're recording this and webcasting it, and it will interfere with that significantly. So if you haven't already turned off your cell phone, please do. And if you get a call and you have to take it, please take it out in the hall. Thank you, and I apologize for interrupting you.
Sure. Okay, very good. Let's look at some of the teaching of these skills now. And I'll start off with some videos that will show how to teach these skills. I'm not going to show how to teach demand right now, because that I'm going to save for after this. I'm going to talk about the tact, the introverbal, the listener response, motor imitation, and so on. Let's look at how to go about teaching these. Generally speaking, we make use of an errorless teaching procedure. In other words, make it easy for somebody to acquire the skills. Try to teach in a way the child makes very few errors for a couple of reasons. Number one, they don't practice their errors. And number two, so as to reduce the unpleasantness of the teaching situation so that you're almost always making the correct responses. Let me show you an example of an errorless teaching procedure that I like to use. There are many others that could be used. I usually start with this one, however, and then kind of change based upon the data and the child. But this is an errorless teaching procedure. Let me describe it to you first in the context of motor imitation.
Vincent, do this.
It's a motor imitation response. And she immediately prompts his hands, as you can see, or at least some of you can see in the video. She immediately prompts his hands. That's the errorless nature of it. Not letting him make a mistake. And says, do this again. And she fades her prompt out by barely touching his hands. So the first trial, prompt immediately. The second presentation right after it, fade your prompt or put in a prompt delay where you do nothing to see if the child can do it on their own. It's called a time delay or prompt delay. So here she's fading her prompt by barely touching his hands. Some distractors. She says, do this, just to kind of change gears, so to speak, to see if we do something different, if we come back to that, will we get the response we want? Again, and she does nothing. That's called a test trial. So it's prompt immediately, transfer by fading, distractors, test. Just to see if the child gets it. That's a sequence of prompt fading that has been shown to be pretty effective as an errorless teaching procedure to teach these kind of skills and language skills. So we'll kind of use that as the basis for teaching most of the skills.
Nice job.
Let's start off with the tact now, using the same sequence. Let's start by showing how we teach the tact. Generally, we teach the tact during discrete trial instruction. In other words, while sitting at a table, as you'll see in this video, child is sitting there, and we're going to run the we're going to run the tact, the teaching of the tact. Here we go.
What's this ears?
What are these, or what's this? What are these ears? She prompts immediately. He says ears.
Ears. Good, Jack. What's this?
There's the transfer trial. Now we're gonna fade a little bit or put a delay in there, see if he gets it.
Yeah. Ears. Good
He got it. That's good. A couple of distractors.
job. Clap your
Head.
and show me hugging.
Hug that.
Good boy. And what's this?
Yeah.
Ear.
And there's the test trial. So we teach the tact by basically, whenever you're teaching a skill, figure out what skill has this child got. Well, this child can echo. Well, if he can echo, and I say ears, he can say ears, but he doesn't know what ears means. He has no idea what the word ears means. So what am I going to do? I'm going to teach him what the label for ears is. I'm going to show him, what are these? And I'm going to prompt ears. So that's what I mean by transfer. We take what he's got, an echoic, and we transfer it to a tact. It's called an echoic to tact transfer. Okay? Watch it again. I'll just let it play. Now, there could be errors here. I'll show you what we do about errors. But that's an example of teaching the tact. So we might have 15 or 20 items with a guy like this. We're teaching him the tacts for all those items. Then we're going to teach him the tacts for items that look a little bit like it, generalization sort of things. I mean, it's much easier if you learn language from everyday life experiences. This is just plain hard work with lots of data recording, precise procedures to teach it. But the evidence is you'll get a better outcome than you will do other things. So nobody said it was going to be easy necessarily, but the outcome is better than if you do other things that are equally difficult. You just don't get as good an outcome. There's no simple way to do this, unfortunately, but there are ways to do it, which is the good news, to develop the repertoire. So we might be teaching 15 or 20 of these to this particular child. Any discussion of how many we're teaching and why and which ones are beyond the scope of this, 3-hour kind of presentation on what verbal behavior is all about in terms of the analysis and so on. Let's look at it tacting with sign language. This is a boy sitting at a table.
Cat. That's right. Fold your hands.
And she signed cat, and he signed cat. What skill did we know he had? He had motor imitation. So we could then show him the motor imitation. Now, if he didn't have motor imitation, we're going to have to prompt physically. But he's got motor imitation. So we say, what's this? Cat. So in other words, we get him to do something he can already do, and we present a new stimulus at the same time that we want to ultimately be the stimulus that he responds to. So we get him to do what he can do in the presence of a new stimulus, and then we fade out the prompt, the thing he can do. We fade that out and make the new stimulus what he responds to, and not just the old prompt that he already knew how to respond to. There's the transfer.
You zip your.
Here comes the distractors.
That's right. What you see over here? Pencil. Fold your hands.
These are all videos of kids in my clinic in New York. Okay? So she did the test trial, and he got it right. Let me let it play so you can kind of see it. Fast, normal speed.
What's this? Cat. That's right. Fold your hands. What's this? You zip your. That's right. What you see over here? Pencil. Fold your hands.
Yeah, no,
What's
I
this?
completely understand. No,
Cat. That's right. Nice job, buddy. Here you go. Here's your movies, and you can watch your video.
Gets a little video and as a form of social reinforcement. Let's look at the same guy with listener behavior.
Touch your nose. Good, buddy. Fold those hands.
Teacher says, touch your nose, and he does that. We're teaching imitation. Why does he do that? Because he can already imitate. Touch your nose, and he imitates it. So there's the known skill, okay? But she's putting a new stimulus in there, touch your nose. So she's getting him to do the old skill, under the old control, so to speak, and trying to transfer to the new stimulus, which is touch your nose. But she pairs them at first and then fades out the old prompt and brings them under the control of the new stimulus. That's the idea.
Touch your nose.
There's the transfer trial. He gets it with a prompt delay.
Awesome. Can you copy me for you?
There's distractor.
And what do you see over here? That is a ear. Fold those hands. Touch your nose.
And now there's the test trial. And notice, no prompt. And now he touches his nose under the control of the verbal response by her, touch your nose. Transfer of stimulus control. Okay? Next one. Let's look at receptive selection. This is Christy with Joey.
Can you give me the swimming pool?
Give me the swimming pool, and she points to the one. She's got pictures on the table, and she points to the swimming pool as the prompt. What skill does he already have? He can follow the direction of the teacher to give things. So he's got that skill. So we're going to use that skill to teach him to respond to the words swimming pool. Right now, he's responding to the physical prompt of which one he gets. He can do that, but the word swimming pool would have no control over his behavior. So we prompt it, we get it to occur, and now we transfer by putting a time delay in, or a prompt delay.
That's
He
right.
moves the pictures around,
Give me the swimming pool.
and now he selects it with no prompt.
Nice job, buddy. Till you tell time with a. Well,
There's a intraverbal, which is a distractor.
those hands and give me the swimming pool. Nice.
And now there's the test trial. We do no prompting, and we test to see if he's got it. Now, there's a lot going on in this video. There's lots of other things he's doing. There's materials. There's organization. That's beyond the scope of this workshop, how we set up the materials, why we do it that way. I'll talk a little bit about that in a minute, but that's a whole nother discussion. The purpose of this is to talk about the verbal operants, the verbal skills, and how you teach them. Let's look at selection by feature, function, and class. This is another listener, and then we'll talk about the
Buddy, give
introverbal.
me the one you eat.
Give me the one you eat, and she points to one on the table. Give me the one you eat, and she points to it. Chips, I think.
Yeah, chips. Nice job, buddy. Fold your hands.
you
Give me
get
the
to
one you
the whole
eat.
She moves the pictures around and says, give me the one you eat,
End of this. And
and he selects the correct one.
Yeah, chips. Nice job, buddy. Fold those hands.
sloppy and I
Can
want
you copy me for hat?
She says, do this, copy me for hat. That's the sign for hat.
Those hands up.
rescore the responses.
What do you see over here?
What do you see here? Attacked, distractors.
Once for the day.
Touch your hands. Give me the one you eat.
Pass it, then
And there's the test trial, and he selects it
Yeah,
correctly.
nice job. You eat chips. Awesome, buddy. Here's your chips. And you
Yeah, okay, and there we go. Let's take a look at, well, you've seen motor imitation already, so let's go to intraverbal behavior. Let's go to several examples of intraverbal teaching.
What says meow?
What says meow? And she shows him a picture of a cat, and he says tat. TC substitution, no big deal. We wouldn't try to change that. He's trying to say cat, he says tat. What says meow? And we show him a picture. What skill must he have that we're using as the old skill to teach the new skill, which is the intraverbal? Yeah, he's got the tact, but we're trying to turn it into intraverbal because we're showing him the picture. So we're doing a tact to intraverbal transfer. We're teaching him to respond to the words, tell me something that meows, with the word cat, but we're prompting it to help him with what he already knows, which is a picture of a cat, and then we're going to fade that picture out and teach him to respond to the words and not the picture. That's called tact to intraverbal. That's the idea, that verbal behavior develops across these categories based upon what you already know. Transfers occur. This is what happens in typical language development. It just isn't programmed this way and doesn't need to be. All these transfers are occurring all the time in typical development. And I'll show you an example when I get done with this of how this happens in typical development. It just accidentally occurs. If people talk to their children, engage their children at young ages, play with them, and they have lots of stimulation, these transfers just happen from your interactions with them without any planning at all. With children with autism, you might do the same thing, but if you don't acquire skills as quickly as typical children, these are the sorts of things you're probably going to need to do to mimic typical environmental stimulation, but make it much more intensive and much more precise.
What says meow?
What says meow? He says cat. That's the transfer trial.
Right. What is it?
Distractor.
Nice job. What's that one?
Tact, distractor.
It's blocks. What says meow?
And now she says, what says meow? And he says cat. Now she's got him under the control of the new stimulus, and now she has an intraverbal and not just a tact. But now she's turned the word cat into an intraverbal and not just a tact by stimulus control transfer procedures, all necessary to get the response to occur. Yeah, sure.
Can you explain the rapidity of the presentation of the therapist?
How fast she's going? Yeah. Yeah, I'm going to show you some data on that in just a minute.
And data keeping? How is she keeping data?
Yeah, and I'll talk about that too. Two questions. Let me finish this and then I'll come back to them. How is she recording data on what's going on here? And she's not. It's the first thing. And I'll talk about how we do collect data. And the second issue is, what about the speed at which this is presented? He responds and she's presenting the next demand almost immediately. Why is that occurring? And I'll talk about both those issues in just a second. Yeah, those are good questions, and I'll address those. Here's another intraverbal.
What's your name, Max? What's your name?
Max.
What?
She says, what's your name? And she prompts immediately, this is an echoic intraverbal, Max. She says it. Well, why doesn't she show him a picture? Because if you show him a picture of himself and you say, what's your name? He shouldn't say, when you show somebody a picture of, if somebody shows you a picture of you and says, who's that? Do you say Vince? No, you say me. So the stimulus wouldn't make any sense to present. What's your name? Me. Well, that wouldn't make any sense. And if you did prompt Max, that happens at an early age, but developmentally, by 2.5 or so, kids will typically say their name when they see it, up until about 2.5. And then after that, they basically say me. Use of pronouns. So what happens here? We have to prompt it echoically. Now, you don't want to do that very often. You almost always want to use the tact to transfer to the intraverbal, because you want to only teach intraverbals about things that the tact repertoire is already there for. Because if you don't know what a cat is, why would you teach them what one does to respond to that? You got to know what a cat is before you know what cats do. I mean, typical kids, what do you think they learn first? The name of cats, or they learn that cats meow? They learn that this is a cat, then they learn, and cats do these kind of things. They don't learn functions of things before they learn the names of things. You learn what a spoon, you can talk about what a spoon does before you know what a spoon is. That usually isn't the way things happen. You usually know what a spoon is, and then you learn its functions. Same sort of idea.
What does a duck say?
Quack, quack.
Quack, quack. Do the same. What's your name?
Max.
Now he says, what's your name, Max? And that's the test trial. Okay, very good. Yeah. Let's do Bobby intraverbals.
What's your name? Bobby. What? Go ahead, fold your hands.
She says, what's your name? And she signs Bobby. That's the sign we use for Bobby, B and a B. B and sort of like a B sign. Bobby. Okay?
Name?
Bobby.
Transfer trial.
Bobby. This is a.
Come.
Show me this one.
Distractors.
Fold those hands. What's your name?
Bobby.
All right, let's watch it again just so you see it all.
What's your name?
Bobby.
What? Go ahead, fold your hands. What's your name?
Bobby.
Bobby. This is a.
Come.
Show me this one. Fold those hands. What's your name?
Bobby.
Bobby. That's right. Here's your video. You can have your chips and your puzzle and your movie.
And you can see that it would be a way in which we would teach that. Let's take a look just for a minute at error. What if a child makes a mistake? Just for purposes of talking about errors. What if a child makes a mistake?
And a snake says.
A snake says, basically teaching an intraverbal here, or she's trying to evoke it. She thinks he knows the answer to this. So she's teaching it or presenting it during the session. She says, a snake says, and listen to what he says.
Nay.
Nay, nay. At least in New York, we think that's what a horse says, okay? I'm not sure a horse says nay, nay, but I'm also not sure a snake says either, so, but you get the idea, okay? We consider that an error, okay? So she's going to correct it now.
A snake says.
So what she does is she doesn't say, no, that's not right. She just represents the stimulus and gives him the right answer. She thought he was going to get it right. He didn't. So she prompts it immediately. So error correction is, if you get an error, just represent basically the demand and prompt the right answer. No reason to do anything else. Now he says,
A snake
there he said it. Now she transfers.
says. Good, what's that?
Distractor.
Chicken.
Chicken, give me a high five.
Distractor.
And a snake says. That's better.
And now he says,
Nice job, what is it?
she shows a picture, tact, and he says, this is error correction, remember? What is it? Well, that's incorrect, okay? So what is she going to do? She'll just represent it and prompt.
What is it, soda?
Older.
So now she gets it. He says Oda. We're not going to correct that. He's 3 years old, and those kind of errors are not unusual. So he says Oda. It's kind of cute. We hope he never loses that, but he will eventually. But it's kind of cute at that age.
What is it?
Older.
Give me 5. What's this one?
Older.
Show me crying. What is it? What is it, soda?
Older.
Why did she error correct there? She error corrected there because he didn't say anything. But give the kid some time, and maybe he would have said it. Well, that's true. If you would have given him 5 to 10 seconds, he probably would have said soda there. But he said nothing within 2 seconds. Our rules that we establish are, when we present things to you, it's an error if you don't respond almost immediately, within 1 to 2 seconds. If you don't respond. Why is that the case? Well, here's the reality. If you don't respond to what somebody says in 1 to 2 seconds, you will not have very many listeners for your verbal behavior. People don't wait 5 to 10 seconds for somebody to respond to other people. Say hello to a friend tomorrow morning when you see them. Say, how are you? 1, 2, 3, 4, 5. Fine. You don't believe them. And there's no way they're fine. If it took 5 seconds to say that, there's something going on. Okay? Either they're distracted or there's some neurological change that has occurred. Okay? So what do you think happens next in that conversation? After it just took you 5 seconds to say fine, you think you ask, which talk are you going to today? I don't think you're interested in which talk they're going to anymore. Because that might take 10 seconds. That's even tougher. That might take 10 seconds, and you're just not going to stick around for that. So if you don't teach children to respond almost immediately to other people's talking, then what you get is a non-functional talker. You get somebody who can talk, but will have nobody to talk to, because listeners will be bailing out. Now, here's the argument for allowing the 5 to 10 seconds. Well, children with autism have a neurological disorder, and they need more processing time. Here's the best way to describe, and I think that is true if you want in in the strict sense of the word. Here's a better way that saying that a child, I think, a better way than saying he has a processing disorder. I like to say children with autism emit long latencies. The time between you say something and they something is much longer than typical responding. There's a long latency. That's what a latency means. You see, you don't treat processing problems, you treat latencies. Treat what you see, not what you think is going on in the brain. Treat exactly what you see. If you see a long latency, treat the latency, not the alleged brain dysfunction that is going on. You don't train synapses, you don't train dendrites, you don't train neurons. You train repertoires, and all of those other things change as a result. You train what you see. Treat what you see, not what you invent to be going on in their head someplace in their neurology. You will be much more effective if you treat what you see, not what you think is going on in their brain. So what do? I say, well, I know that the latency is long. I'll know when I fix that problem. I'll get shorter latencies. What's the research literature show on latencies? The research literature shows that if you don't allow the latency to occur, instead you prompt immediately and shorten the latency and give reinforcement for the prompted shorter latency, you can then fade your prompt and you'll get shorter latencies. That's what the research literature shows. So I will treat the latency and completely ignore that he has a central auditory processing disorder, because it provides no tactics that lead to more effective treatment by saying that. And that's what I'll do. Plus, if you want to diagnose CAPD, they've got to see an audiologist who has to do an enormous amount of testing, of which most children with autism are not good candidates for the testing. So I just ignore it and basically treat it as a latency problem. And watch what happens. Excuse me one second. With me one second. Watch what happens now when we treat the latency. Watch. Here we go.
Show me crying.
That's his crying, huh?
What is it? What is it? Soda.
She prompted 2 seconds. He didn't answer. She prompts soda.
What is it? Give me 5.
The way you're going to know if the latency shortened up is on the test trial. Is it going to be a long one again? Watch.
What's this one? What does a pig say? What is
Here we go. What is it?
it? Good.
Now the latency is nice and short. Now the latency was 2 seconds. He came in within 2 seconds, and now we shorten the latency, and we think that the latencies will continue to shorten up. Treat what you see in the repertoire of the child, not what you invent to be the causes in their brain. I mean, here's the issue. If you want to know if a child has improved in your classroom, does he have more language? Are you waiting for the end of the year to do an MRI, an fMRI, a functional MRI, to see whether or not the language portion of the brain now lights up more? You're thinking, well, I don't really know if he's any better. I need that fMRI to see if that language... Are you waiting for that? Take a look at him. Does he talk more? You've recorded lots of data. Does he talk more? You don't need an fMRI, functional MRI, to know that. All you got to do is watch him. He'll tell you. And I bet the fMRI, if he's talking more, will light up in the language area also, but who cares? He can talk more. If that part doesn't light up, are you going to say, well, I guess he didn't meet his goals and objectives because it didn't light up in that particular area of the brain? Well, that isn't the issue. It's what you see in front of you that matters to you, not whether or not his MRI has changed. And physicians will tell you all the time that they will see brains of people after strokes and think, I'm going to go see a patient who's going to be in very bad shape, lying there almost comatose, and they walk in and the person's sitting up talking. And they say, this brain scan is that, they think they got the wrong brain scan. That's that person? Or they'll go in and say, this is a mild sort of thing, I think I'll talk to him about what's going on, and they see the person unresponsive. I mean, the relationship between what function looks like and what those scans look like aren't always exactly perfect, direct relationships. But despite that, you hardly need that information. Look at the child. You'll know if he's getting better. Record some data. You had a question, then I'm going to get to yours in a second. Yes, go ahead.
So as a parent,
Yes.
that would frustrate my son to know, and he would immediately there would be all kinds of bad behavior and problem behavior.
What would frustrate him?
His perceived rushing. Because he'll say, you're rushing me. I'm not done. Let me think of hard. I'm just,
How would you do that? She says that if you tried to do that, your son has a lot of language, first of all. Yeah, and he would say, you're rushing me. So here's what I'd say to him. I'd say to him something like this. I'd say, because he could obviously understand what you're saying, very different than with Declan. There's nothing I couldn't say, hey, Declan, I don't mean to be rushing you, but he has almost no language. So, but I would say to the child something like this. Well, let me give you an example of this. Somebody says to me, what did you do on your vacation in 1998? Okay? And if the person, if I just stood there and the person said, now come on, tell me what you did, now tell me what you did, that'd bug me too. But here's what I do, and here's what you could teach your child to do. Somebody says, what'd you do on your vacation in 1998? That's going to take me a while, and as I get older, it takes me longer and longer. But here's what I do. I don't just stand there. What I say is, give me a minute to think about that. That's what you want to teach them to do. Just say, hey, I need a second to think about that. Completely appropriate. That's all people expect. That's what I mean by responding within 2 seconds. You don't have to respond with the answer in 2 seconds. You have to respond in some socially appropriate way that keeps the listener with you. Teach them to just say, you know, I need a minute. 1 second, it's going to take me a second. And then allow him the time to do that. Because people will wait when people say that. And that's what I would do. What do you do on your vacation in 98? Give me a minute. Let me think about that. And then what I would typically do, if it's going to take me a while, I'd start saying things like, well, see, I would actually start talking out loud, thinking out loud. Now, why do people do that? Because they don't want the listener to go away. Because if I said, well, give me a second, I need to think about that. You get the idea the listener's gone. But if I say, okay, 98, let me see where I was. Okay, I was living in New York. Okay, then I went. They stay with you. So it's teaching the pragmatic skill, and that's why we teach that. Either we teach them to respond quickly for somebody we can't teach the pragmatic skill to yet, or we teach them the pragmatic skill that allows them to keep the listener there and therefore respond. So I would teach that. Okay. That's a good example of the error correction. Let me show you a video now of all of what this looks like when it all gets tied together in discrete trial instruction. Okay, I'm just going to show you just briefly this video.
All right, Sylvia, you need 40 tokens for your prize. Finish out with your hands folded. There.
This is a girl with about a 2.5-year-old language level. Okay, and I've showed you everything in slow motion, prompting, prompt fading. We've looked at it, and that's what you need to do. You need to practice it in slow motion. You need to get the prompt, fade procedures down. But when you put it together in a session, it looks like this. You're going to see mands, tacts, echoics, interverbals, listener behavior, motor imitation, all kind of played together, mixed all together at a very fast pace. And then I'll answer your questions on data and pace.
What's your first token? What are these ones?
Spaghetti.
That's right, those are spaghetti. What are these here?
Fingers.
Fingers. Do this one. And what's this one? Bow.
Bow.
What is it?
Bow.
Good. There's a token for you, Sylvia. What's this one called?
Toothpaste.
Toothpaste. Touch your hand. Good. What's this one called?
Bow.
Oh, good, Sylvia. 2 tokens for you. What's this one?
Radio.
A radio because it's blues.
Cruise.
Blues.
Cruise.
There you go. What's this one called?
Fight.
That's right. It's a slide. Tweet says a.
Bird.
And what room is this? Kitchen.
Kitchen.
What room is it?
Kitchen.
Kitchen. Good. 1 token for you, Sylvia. Say puzzle.
Puzzle.
And what's this one called?
Spoon.
Spoon. What room is this?
Kitchen.
Kitchen. Good, Sylvia. 2 tokens. What animal here?
Nick.
Say marker.
Marker.
What's this one called?
Pakeka.
A popsicle. Good. There's another token. What's this one?
Candy.
Candy. You got it. And what's this one? Comb.
Comb.
What is it?
Comb.
Comb.
Notice that was just teaching attack. What is it? Comb. She prompted comb. All the things I showed you in slow motion, but is now being all in there. And we're seeing interverbals, we're seeing tacts, we're seeing motor imitations, echoics. Everything is kind of mixed together, and it's at a very fast pace.
Good. 1 token, Sylvia. What's this one called?
Fish.
Can you do this one? And what am I doing?
Blowing.
Blowing. That's right. And what's this one called?
Fish.
What is it? Comb.
Comb.
What is it?
Comb.
There's the error correction. She showed a picture of a brush and said, "What comb?" And she said, "What is it?" She said, "Brush." It's called a metonymical tact extension. Things that are typically go together. You could say the wrong name. What is it? It's a comb. But what's usually, if there's a comb around, there's probably a brush around as well. So she said brush when in fact it is a comb. It's a kind of a tact extension. What's the purpose of the pace instruction, the mixing, the teaching this way? The purpose of it is to reduce the motivation to become frustrated and escape. Okay? The issue is that if you don't need to teach this way, well then don't. Go at a slow pace, and if the child acquires it, fine, and it's no problem. If you have somebody who tends to be distractible, tends to have problem behavior, and doesn't attend to things, if you don't teach by mixing everything errorlessly, fast pace of instruction, and all the other techniques that are being used here, you lose their attention. So this is all designed to keep her attention in somebody who would not attend if taught in another way. If you just said, what is it? Okay, very good, nice. Touch your nose. Okay, great. What says meow? She said cat. I mean, if you could teach that way, it might be okay. But Sylvia would be checked out. You'd be constantly saying, Sylvia, pay attention. Listen to me. And in some of my workshops, I show what kids look like when you don't teach this way, and then what they look like after you teach this way. So these are behavioral procedures unrelated to verbal behavior and the analysis of verbal behavior. They are techniques that are in the body of literature on applied behavior analysis. Now, one of the issues that you see in that video, well, let me back up. This is a paper that those of you who are interested can go to my website, carboneclinic.com. It's a paper we published in 2010 on why we teach this way. That's what that means, the CMOR, conditioned reflexive motivating operation. It means problem behavior occurs when you try to teach this way. If you look at this paper, it describes all the teaching procedures. It's unrelated to this workshop, so I can't spend time going into it. I just wanted to show you what it looks like. But you can read this paper that shows that. The second paper you can read on our website was published in 2012 in Behavior Modification. Carol Roxburgh and I, Carol from Wales, we did a study on pace of instruction. One of the questions the lady up front asked. What about pace of instruction? Why go so fast? What we have found is, and some of the previous literature showed this, if you go slow, you get more problem behavior, either self-stimulatory, automatically reinforced, or escape motivated. Kids check out or start stimming if you go slow. And we looked at that and we analyzed it and we ran a research study on it to look at that particular issue. And what we found was the faster we went, the less problem behavior we had. Now, you may have to build up to it in some kids. You may have to start slow and build up to it. The point being is that this paper shows some nice data. I'm not going to bore you with too much data at this late time. Let me see if I can avoid falling off this. This right here is the number of problem behaviors. This is time, sessions. This is David. Look what happened when we put 1 second between each demand. Look how low the problem behavior was. Look when we put 5 seconds. Problem behavior is going up. Look when we put 10 seconds. 4 times as much problem behavior. And it's the same with Sarah as well. Both participants showed much more problem behavior when we went slow versus fast. So that's one of the issues discussed in this article here, and here is some of our published research to verify that, or validate that. The other issue is, how do we take data? We take data during discrete trial instruction when we're teaching all of these verbal operants. We take it before the session. In other words, we're going to teach 5 tacks during the session. We'll say, what is it? We'll record yes or no. What is it? Yes or no. What is it? Yes or no. We'll take the data. Then we will teach. Tomorrow morning, when we go to teach those 5 tacks again, we'll take the data again and see if overnight there was any loss. Did the person acquire the skill during our teaching of the tacks? So we'll take data, we'll do the teaching procedures as you've just seen, and then tomorrow we'll take the data again. What's the advantage of that? You get more teaching, you take less data, and it seems to match trial-by-trial data. In other words, if you took trial-by-trial data, you couldn't teach this way. If every time you had to write down exactly what the child was doing each time, it would get in the way. There are 3 published studies that show that the difference between probe data and trial-by-trial data is very small, and that you get good representative data under certain circumstances. Read the papers on that. If you use probe data as compared to trial, and you get more time to teach. That's the reason why we do that. Yes?
How many times do you introduce the same item that you're trying to teach the tack on?
How many times do we introduce the same item? It will depend upon the child and the data. In other words, if we introduce it 2 times today and he's acquiring it, then I'll continue to do that. I introduce it 2 times and it seems like it's not, I'm going to introduce it more. I'm going to let the data and the child's responding kind of guide what I do on that.
How long is a typical session?
Typical session like that is about 15 minutes. And there's a break about every, 3 minutes or so with this little girl. A break about every 3 minutes or so to watch a little video and do a little something else, and then for a minute or two, and then right back to teaching. So the session is usually about 15 minutes or so.
My question was rapidity. How do you teach your therapist?
Oh, the instructors.
How to be that fast?
Ah, yeah, how do you teach the instructors to be fast? Practice. Yeah. A lot of practice outside of having a child in front of you. Practice with colleagues. In other words, and it can take some time. We have checklists that we use, competency checklists that we basically run them on the instructors to build up their ability to do that. So we have a set of checklists on that, and we keep giving them feedback. But a lot of practice outside the session. Okay, I'm going to teach Sylvia these 10 things. Sit there and let's make all the right responses. And then sit there and make a few errors and see if I can respond to it. It takes a lot of practice. Yeah. But we haven't had many people who couldn't learn to do that. People learn it. A couple of people here from the VV project, you guys teach that way as well. Yeah. How would you take data before the session? Well, the 5 tacks that I'm going to teach during this 15-minute session, I just hold them up and say, what is it? And I circle yes or no. And I just kind of test them. I do a test. And then I teach, and tomorrow I test again. That sort of thing. It's like a pretest. Yeah, exactly. Yeah.
Are your competency checklists on your website or anything?
Yeah, there are some on my website. Yeah, you can take a look at those competency checklists, sure. Take a look at them. Demand. In the next 35 minutes or so, let's take a look at specifically demand and how it's taught. Those are all the verbal operants that we've talked about so far. And once again, this is an introduction to this topic. It's certainly not comprehensive. Nobody's having to do anything in terms of teaching, but I hope it gives you some information that you can go back and use and think about in terms of the conceptual analysis of language as well as the practical teaching, and you can explore more and spend some time learning some of these things with a consultant, with somebody who can help you, with behavior analysts, other people, or self-study in order to do that if you're interested in what we've had to say. A mand is basically a request. Mands are emitted when motivated for something. It's an important verbal behavior. It's almost always the first repertoire that is learned. So many of our programs with children who've acquired very little verbal behavior does not start with all the skills I've just shown you so far. It starts with manding, and then we teach the other skills. So this is kind of out of order a little bit, but it made sense for this presentation to do it out of order. We would start with manding. We would start with teaching a child to respond. So maybe 2/3 of the session, let's say we had a 3-hour session, 2 out of 3 hours would be spent natural environment teaching manding, and maybe only an hour broken up in 15-minute blocks would be spent on teaching some of the other skills based upon the child's assessment using the VB map. So it's a very important repertoire. Mands develop early on. They develop in the first year. Here's one of the mands that starts to develop just before talking occurs. Vocal mands. All the other mands that I've described occur crying, pointing, those sort of things. Here is joint attention. This man usually develops 9, 10, 11 months, and it is a mand that occurs just before vocal responding usually occurs. It's a mand for other people's attention. So take a look at this. This is Kellen again at about 11 months. Take a look at this man just before vocal, and then I'm going to go into vocal responding. You notice he's sitting there, and I'm sitting there kind of next to him to his right. He's about ready to eat something, and he's got some water there. My wife is holding up an iPad, and on the front of the iPad is the symbol for the apple, and he notices that. Okay, so he notices the apple symbol there. This is an example of joint attention, manding for me to pay attention to it. Watch what he does here. First thing he does is he notices it and points at it. And that's usually the start of joint attention. a bid for joint attention. The next thing is you look at the person to see if that person is looking at it. That's why they call it joint attention. Both of you jointly attending to something interesting. This is an indication that social attention is a reinforcer, and it's a mand. It's one of the first mands that occur before vocalizations occur. It usually occurs anywhere between 7, 8 months, usually closer to 9, 10 months or so, in typically developing children. Point and they look at you to see if you're looking at it. The reinforcer for that is your attention. Okay? So he's pointing at it. There he goes. Now watch him look at me. Did you see that? You see the look. It's that back and forth gaze that is a mand. It's one of the earliest mands. He tries to say something there.
Apple.
He tries to say apple there, as you can see.
Ba.
Now watch here. He does it again.
Ba.
What's that?
Now I respond, what's that?
Ba.
Show me.
Ba.
And he signs apple. Okay?
Apple.
Now he gets excited.
Boy, baby.
And then he slams his cup down on the table and water goes every place. But it was worth the fun. Okay? Well, that's an example of joint attention. That occurs usually at about 10, 11 months by then, and it usually is the last man that occurs that is kind of non-vocal. Then the vocal mands start to occur at about a year old. And let me now, and I've gone through much of this information already on manding, so let me show you videos of how we go about trying to teach the first vocal mands. Okay? Here's Maddie. We provide him motivation, reason to talk. We prompt the response, and we deliver the reinforcer.
Fry. Fry.
He's grabbing for a little fry. We say fry, he says fry, and we give it to him. We don't do any prompt fading at first. We just get a child to imitate what we say and get what they want. In other words, they tell you what they want, we say the word, they imitate it, echo, we give it to them. Just the idea, make it easy. Just talk, you get, talk, you get. I don't say, now say it again without a prompt or anything like that. I just give them the items so that they learn. I talk and I get things, I talk and I get things. I prompt them to help them.
Yeah, there's your fry. Good, bud. How about the chip?
He's grabbing for the chip. She knows he's motivated for it. She says chip.
Chip, good.
And now he gets the chip.
Candy. Candy.
She said it twice that time because she thought, I can get a little better response. So now she's starting to push him to say it a little better. Nothing independent yet. It's all completely prompted. Just talk, get. So our sessions are, let's play with them, let's have food items, let's have toys, let's make things fun. He shows his motivation for something, and we prompt. Now don't do too much of that, or the child will say, boy, every time I show interest in something, I got to do something to get it. So just intersperse them in the context of play.
Candy, good, Maddie. Cookie. Cookie.
She said it again because it was unvoiced the first time, and the second time it was a much better response. So those are examples of some of the first mands. Just start playing, have items available, and prompt. Let's look at now how we fade our prompts out. Let's look at an example of this. This is Jack. Transferring control from the man.
Look, Jack! Did you want to make noises? Train.
So she says train, he says train, he gets it. Once again, same sort of idea.
Good boy. Yeah.
Can you still hear that? I don't want to annoy the people next to me.
Yeah, now what you can do is sort of use dinosaur. Good boy.
He says, he grabs for it, she says dinosaur. So in other words, you let his motivation tell you what he wants, you give him the name for it, he echoes it back, and he gets it. Why are we using the echoing here? Because we know Jack can echo a little bit. If he couldn't echo, we wouldn't be doing this. We would be basically teaching him the sign immediately. We'd be prompting the sign or the picture immediately. But since he can echo a little bit, we're going to have him echo. He has an inclination. If his echo was weak, he either wasn't inclined or you couldn't understand it, we'd be using sign or pictures in order to make it impossible to frustrate him, to not allow him to get the things he wants. Because he's unwilling to, or better put, incapable of echoing, well, then you're going to be sitting there saying, well, you don't get it until you echo. You get the problem that will cause. Your session will unravel pretty quickly, and you'll have a child who doesn't want to talk at all because you're making me do things I can't do. So we'll start to use sign language, where what can we do? We can prompt his hands every time. He can never fail to make the response. So we'll always get a response from him because we can prompt it with pictures. You can prompt it on an iPad, let's say. You can prompt it. Okay. Let's now look at, back up. Let's look now at using a prompt delay to get him more spontaneous. So far you've seen children where we prompt them, they say it, we give it. We prompt them, they say it, we give it. Now let's start to fade the prompt out. He's sitting there watching Dora, an activity.
Dora.
Dora.
He talks, he gets it again. Abby gets pretty excited.
And you can have a boy. Can I have a boy?
Supervisor is saying, try to just hold out now and do a time delay, prompt delay. Just wait to see. You've prompted it. Now let's kind of build the motivation. The video's off. And let's see if he'll now say it without our prompt. It's a time delay prompt procedure. Now you could do something like give a couple of phonemes also, so that might prompt it. You could do that. I like to do prompt delay because I usually get better responding with it, but it may not be in all cases. You figure out what the prompt fade needs to be based upon the child you're working with.
Represent me.
So here we go. He's watching it.
Dora.
Dora.
Yay! I knew the good things were going to
So
happen.
she prompted again.
Yeah.
Now she's waiting even longer. And the supervisor says prompt him. If you go too long, he's going to either lose interest or problem behavior is going to occur. He's going to say, you know, I have another way of manding for Dora that you may have forgotten about. It's called biting, kicking, slapping, and hurting myself. So I might do some of those things too.
Dora.
Dora.
Dora, good boy.
Okay, so she had a prompt. So she's adjusting her time delay to fade the prompt. Now we'll watch it actually work with Minnie. We've done enough of those 3 or 4 second delays. And with manding, don't worry about the speed, because with manding, there's no latency. You don't know the point at which the MO kicked in. So with attack, you know when you presented the stimulus. You don't know when the MO is there. So I don't say, well, you don't let him go more than 3 seconds. It doesn't matter with the mand. You don't know, just let him mand.
Say them to me on my fourth.
Dora.
Dora.
She prompted, but you notice he almost said Dora on top of her, suggesting he would have said it on his own if she didn't prompt. So the supervisor says, next time, don't say anything at all, just wait. Watch Minnie, the teacher. She can hardly control herself from prompting. And she then looks at the supervisor and says, watch your mouth. Prompt? Like, should I prompt? And then he says it.
Yes.
This time we're going to try to get under the item.
Bring it under the control of the item.
Right now.
Look at her. She's trying not to say it. Prompt.
Yes.
So now we've got it independently. It's that sort of thing. He talks, he gets it, he talks, he gets it, based upon his motivation. Now we wait, or we provide a phonemic prompt or some other prompt that we faded out, and now we're waiting for him to say it on his own. That's the way we'll develop mands. So we build motivation for as many items as we can, and we run exactly that procedure. We get the mand to occur. And what's the advantage of the mand? When I talk, I get strong reinforcement. You want the first words to be strongly reinforced. Why does the mand develop first? Because it gets the strongest reinforcement. It gets exactly what I want. With attack, you get an attaboy. Well, at a year old or so, way to go isn't as strong as getting the juice when you want it. You can see why the mand develops first. So provide the strongest possible reinforcement as early as you can, and then start to teach the tact, the echoic, the introverbal, and all those other repertoires. because the reinforcement for them are weaker and probably not as functional at first. Because the man gets rid of problem behavior, teaches the child they enjoy talking, and talking gets reinforced. Yeah. Here's what happens just a few weeks later. I may have to make this louder to hear it.
Tiger.
He says, tiger. This is what happens now in a session where we've done exactly that for each one of these items, and now he independently, unprompted, responds.
Elephant.
And now he asks for the elephant, and now he's got dozens of things that he'll ask for independently. This is a guy who would walk around all day and never talk. Now we've got him where he's independently requesting things, manding for things. Now at the same time, we're doing some discrete trial instruction. We were teaching him some tacks. You remember Jack, we were teaching him some tacks. That's the guy that said, nay, nay, what does the snake say? We're teaching him some tacks. We're teaching him some listener behavior, some motor imitation, a whole host of other things going on. But 2/3 of a session is this sort of opportunity to talk, basically manding. Here's an example of prompt fading with sign language. This is Pedro. And this is my younger brother from 1998 as well. Okay? This is 16 years ago. Some of you weren't out of high school then. Certainly, maybe not even in grade school. It's awful. But in any case. Okay, this is San Juan, Puerto Rico. This is Pedro. He's learning to speak Spanish. I don't speak Spanish, so the people in the background are saying the word in Spanish while he learns to sign. Otherwise, he would learn to say cookie in Spanish with a New York English accent. Okay? And it would sound like galleta or something like that. So I'm not saying anything. The native speakers are saying the word. I'm just doing the teaching of the sign. Normally the teacher says the word as well, but I can't. It wouldn't be good for Pedro. So here we go. I teach him to sign cookie. Just like this, something like that. I prompt his hands. He has poor motor imitation, so I'm prompting his hands.
Sometimes you want to put it right in the mouth because it gets the reinforcement quicker.
Galleta.
No, there's no opportunity to be wrong either. Can't make an error, can't make a mistake.
Galleta.
I show him the sign, I prompt his hands.
Okay.
Now the word is being paired with the sign.
Galleta.
I try to bring the item close to him to see if the MO is still there. That's why I'm making it so salient, because I want to make sure that he's motivated for it. I'm prompting sign language with basically physical prompting in this case.
Look at him moving his hand.
Notice the grab, which signifies the motivation. You've got to wait for the declaration of motivation before you teach. If you have no motivation, sometimes it's an eye gaze, it's a grab, it's something that tells you, if there's no MO, you're not then teaching mands. It's under the control of the MO. I show him the sign, I prompt, and there, something close to the sign with a faded prompt. We all got excited, we were pleased. We made such a loud reaction to it that Pedro never signed again. This was his first and last sign because we scared him. No, not really, but you can imagine how it might. He did look over at me like, what the heck is that? But I'll show you. Let's look at the prompt fade procedure again. I show him the sign. Notice I barely touch his hands. And notice how I'm barely touching his hands. This is like the 10th trial. So I'm fading from the very beginning. I'm fading. There he goes. Now I get my hands out of there. And if he now did this in the presence of a cookie, if he walked over to his mother and did that, who wouldn't know what he was asking for after this training session? It'd be fairly clear. Yeah, there he goes. And he then looks around like, what's going on? Okay, let me show you another prompt fading procedure with an older guy. This is Peter.
Did you crack and bottle it?
Okay, I'll show you Peter. Prompt fading.
Did you crack and bottle it? Good.
So we did a gestural prompt for cracker. Okay, it's Dorothy working with him. A gestural prompt for cracker.
Come right back with another one, Dorothy, and a slight gestural prompt.
I tell it, now fade your prompt immediately. That was one of the first trials. He's got good imitation, so we did that immediately and we gave it to him. I said, fade your prompt immediately now. Barely move your, I was telling her, barely move your left arm up into this position. Don't bring your hand over. Just do this and see if that's enough. Watch.
Get the left hand, your left hand into that.
Notice as soon as she got her arm in this position, then he came over and did that. Nice fade.
That's it. Good. Now bring another one up.
Now bring another one and do another fade. And this time, what I wanted her to do was just barely move this arm as a gestural prompt and see if she gets it. And you'll see she hardly has to move her arm and he mans.
And just barely.
She didn't do anything and now he's got the man. So in 3 trials, we're able to teach it with a full gestural prompt, fade, and then get it actually independently. That's why you need to start fading from the first trial, because you won't know how quick it is unless you start fading. But also don't fade so much that the individual gets frustrated by the fact that you're not getting the reinforcer to him quick enough, errorlessly. So you've got to do a balance there of that. But that's an example of teaching sign language to an older individual with prompt fading procedures. Those are some good examples of manding related to this topic. We published a paper in 2007 on transferring skills to the motivating operation. If you're interested, it's another paper on manding. It's on our website, this paper with Emily and the other people. Leo Bryan's doing a presentation here as well. This is a paper we published in the analysis of verbal behavior. And these are the data. I won't go through that. If you want an overview of the establishing operation, in other words, motivation, and teaching verbal behavior, which is a major component of it, I published a paper in 2013 in the analysis of verbal behavior, which is an overview of a lot of the things we've talked about. So if you want to read some more about this topic, this paper is available. If you go to my website, I've got a full text version of it on my website that you can kind of take a look at as an overview of using motivation to teach verbal behavior. Now let's look at some extensions of this. Let's continue with the manding issue, and let's look at extensions. What are some of the extensions of this language training program? What are they? What are some other things you can do in the context of language training? Well, there are basically 3 things that I want to address here. I want to address how you increase the number of mans you get from children as they begin to develop one-word mans. How do you begin to increase them? Increase the length of utterance to 2-word mans, which usually occur about 2 years old. And that's called an interrupted chain procedure, which I'm going to show you in just a minute. The second thing I want to show you is teaching social skills. Where does demand as a form of verbal behavior come into teaching social skills? It's my contention that many social skills that are taught are, as Bill Doobie sometimes refers to them, as imitations of meaningful behavior. They're kind of imitations. There are children engaging in social skills, but for all the wrong reasons. In other words, they're doing it because they get a couple of tokens, they get a M&M, they get a cracker. But that isn't the reason why you say hello to people. You don't walk past somebody and say hello and say, boy, I hope they give me $5 for saying hello to them. I mean, that's not why you say hello to somebody. You say hello to somebody because their reaction back to you is a reinforcer. That's the reason why you say hello, or to avoid the awkwardness as well. But let's say you're genuinely, you see somebody and say, hi, how are you? What you're doing is, what's the reinforcer for that? It isn't, good job, you get 2 tokens for having said hello to somebody. Teaching kids with autism to interact with other children because they get cookies, crackers, and tokens probably never turns into real social skills. When I'm hungry for cookies, crackers, and I want tokens, then I'll engage in social skills. But that's not the condition under which you do. The condition under which you engage in social skills is when other people's attention is important to you. So we've got to teach kids to respond to other people's attention as a reinforcer. We've got to make attention a reinforcer. And that's all tied to verbal behavior in the man. So let's go through a couple of examples of this in the 10 or 15 minutes we have left. This is a paper on the interrupted chain. This is a paper we published recently in the journal, The Analysis of Verbal Behavior. Myself and some of my colleagues at our clinic in New York. We taught children to ask for things. As a result of wanting one thing, something else became important, and we taught him to ask for those things. It's called an interrupted chain. These are some data. Let me show you what that looks like as a video example. This is Declan and Danielle. Watch what happens here.
Water. You want to have water?
So he said water. He wants water. So we know we've taught him that one-word man for water. That's good. But now we want to expand on that. So here's what we do.
How?
This usually occurs at about 2.5 years old. This begins to occur.
Water. Okay, let's go get some water.
Let's go get some water.
Okay.
Okay, here's the setup. There's your water. But he never drinks out of the bottle. He only drinks out of a cup. He doesn't know how to open the bottle, and he doesn't know how to pour. So now what does she do? She hands him the bottle, which is not the circumstances under which the man for water is typically reinforced. So what now becomes valuable to him? If I want water, but I need a cup, I need it opened, and I need pour, what becomes valuable is a cup, opening the bottle, and pouring. Interrupted chain. In order to get to the water, I've interrupted the chain of responses, and now I've got new reinforcers. Cup, opening the bottle, and pouring. So now what can I get him to say? Well, watch.
Here's your water. Cup.
Now he says cup. So I took one man for water, now I turned it into two mans. Here comes the third one.
You need the cup too.
Sure, there's your cup, and here's your bottle of water, which now is the circumstances under which open water becomes the response.
Here you go. Open water.
Now I get a two-word man, open water.
Open the water, sure.
And you might have to prompt these at first, but you have the MO in place.
No. Pour.
And now he says pour. Get the idea? Interrupted chain. So once you've got a lot of one-word mans, expand on them. Turn them into talking in the context of lots of different opportunities, within the context of the play activities you've done. Now get them to talk even more by manding. It's called an interrupted chain procedure. Take a look at our publication on that. It was first published in '87. That concept of the interrupted chain was published by Mark Sundberg and Janae Hall in 1987 on the interrupted chain. We extended that. And did a couple of things a little bit differently with, first of all, it was kids with autism. Their paper was not with kids with autism. So we demonstrated it works with kids with autism, and there were a few other methodological differences that we had. Take a look at that. That's how you expand the man repertoire. Well, now let's look at social skills. Let's take a look at two examples of social skills. One of them, eye contact, and one of them is asking other children to play with you. Where does verbal behavior, the analysis of verbal behavior, and the emission of verbal behavior come into teaching of social skills? I think it's right at the heart of it. Demand is right at the heart of social skills, I think. Frequently, well, I'll back up and I'll come back to that point in just a second when I show you the second one. Let's take a look at the development of eye contact. Here's what happens. If you're sitting at a dinner table and you're about to mand for something, like the salt is over there, and there's somebody sitting right next to you here, and the salt is over there. You'll rarely do something like this. Pass the salt, please, and just look straight ahead. You'll almost never do that. Now, why won't you do that? Because that response will almost never get reinforced. Do you think the person next to you will say, oh, you're talking to me? Sounds like Bob De Niro. Yeah, you talking to me? Are you talking to me? Well, no. I mean, the person's not going to, they're going to say, what's up with that guy? But what do you do? What do you know works? You know doing something like this. Excuse me, getting their attention so they look at you. As soon as they look at you, then you say, would you mind passing the salt? In other words, mans where you're not making eye contact almost always go unreinforced. So what can we teach children to do? We teach children after 15 or 20 mans to start making eye contact during manding. Why do that? Number one, their mans will be more reinforced. Number two, it changes people's perceptions of who the child is when they look at you and talk to you. Children who look at you and talk to you are considered different than children who talk and are looking down, looking away, not looking at you at all. They're different. And I think it brings about a different reaction to the child. Plus, it makes the child's repertoire more functional, which is the main reason. So here's how we do it. Here's what we do. Remember Jack?
Not Jack! Did you want to make noises? Trying.
Look where he's looking when he mans.
Try.
He's looking right at the item. He doesn't make any eye. Now, people do things like hold the train right in front of their face and say, well, look, but if you put the train down here, then he looks there. I mean, he only looks there because the train is there. They do stuff like this. They grab the child's face and get him to look. That almost never works. If it does work, it's because the child is tired of somebody grabbing their face. As soon as they're around somebody who has no history of grabbing their face, they're not going to look at them. They're going to do it because you're bothersome to me, so I better look because you're going to grab my face, and I don't want that, so I'll just as well look. But I don't look at people during a conversation because they say, boy, I hope they don't grab my face. That's not why I look. I look because their attention is reinforcing to me because it's related to some reaction that is necessary to continue my verbal interaction. And in the case of manding, it's to get the reinforcer that I'm asking for. So that's why that's important. So here's what we do. After 10 or 15 pretty strong mans, we run a treatment program for eye contact. Here's what it looks like. Angie, in this case, is holding out a marshmallow. Typically, Jack would just say marshmallow. He'd be looking at his toy, and he'd see the marshmallow, and he'd just say marshmallow, and we'd deliver it. But now we've started treatment. And treatment says we don't deliver the marshmallow as a man until he looks at us. Well, what happened? Why does he ever look at us then? I mean, why would he ever look? Without telling him, hey, look at me, because Jack wouldn't respond to it, and I don't want another prompt that I got to fade. So what do? I let extinction work. Extinction for the man produces variability. When you put a response on extinction, you get new and different responses. What could be one of the new and different responses? Eye contact, especially if it's someplace in his repertoire. Go to a soda machine, put your money in, get soda. Put your money in, get soda. Put your money in, get soda. You're reinforced for that same behavior. Now you put your money in and you don't get soda. You don't get extinction. Your response that is previously reinforced, reinforcement is now withdrawn. What do? Put your money in, don't get the soda. Oh, I guess I don't get a soda today, and you walk away. No, people don't do that. Extinction doesn't make you give up. Extinction makes you more resistant to that outcome. What do? You start banging on the machine. Some of the machines even now say, don't shake this machine because it could fall on you and hurt you. Because they know extinction is going to induce the tendency to do that. You've seen that on those machines. Don't shake it. Because they think somebody's going to get killed and they need a sign there to protect them legally from somebody doing something foolish, like going to McDonald's and getting the hottest possible coffee you can and pulling away from the drive-in with the coffee between your legs. You've heard of that incident in America. Person did that and sued and got millions of dollars from McDonald's. They needed to be told, don't put boiling hot coffee between your legs as you're driving. In any case, it won. So they now have, on the machines, they say things like, don't shake the machine because of extinction-induced variability. Watch Jack here.
Why should look?
Look, he said marshmallow, but he didn't look at her. She didn't say, oh, yeah, here you get it. Look, she's not going to reinforce. Watch the next response.
Why should?
Look, he looks at the marshmallow, thinks, maybe I got it wrong. Maybe it wasn't a marshmallow. That's extinction. Extinction trial number 2. Watch the third trial. The third time he looks at her. Extinction induced that. We didn't have to say, look at me, Jack, pick your head up. You don't want to do that if you don't have to, because you have to fade that out. If you can get it through extinction, all the better. We're able to produce eye contact in many, many children during manding by running this procedure, and it begins to look like this. Let me back it up a little bit and show you what it begins to look like. Yeah, let me just back up just a little. Okay, here we go.
Thinking, orange out.
She delivers the, whoop, I don't want to be there. Be right here.
Yay! Old MacDonald had a farm, E-I-E-I. Cow.
You wanted the cow.
E-I-E-I.
Oh, there it is.
The farmer in the den.
Cow.
Notice how he looks at her. Watch this next one. He goes out of his way to look at her.
Cow.
Look where the eye contact now goes. This is after a couple of weeks of training on this. He's now looking.
Cow.
Nay!
And watch this last one. Look where the item is. Look what he has to do. Tractor, and he looks right at her. Notice how natural it looks. The reason why it looks natural is because the analysis that we use is the analysis of how typical people learn to make eye contact during manding, and we use the same. If you get the analysis wrong and you say, look at me, good looking, and you get a token for that or an M&M, that's not the way children learn to make eye contact. They learn to make eye contact during manding based upon extinction-induced variability for their mands when they weren't looking at somebody. That's what taught them to engage in eye contact. If you use the right analysis, you'll get the right outcome. I got about a minute left. This is a paper that we published on this. So this procedure has been empirically verified as a useful one. I think it needs replication and it needs some other things. But this is a paper we published in 2013 in Education and Treatment of Children on teaching eye contact. If you want this paper, it's on our website also. You can download a text and kind of look at the procedures we ran to teach it. The last thing I will show you is the teaching of social skills related to inviting somebody to play. Take a couple of minutes and then we'll be finished. Children with autism frequently do not ask other children to play with them. And instead, people run social skills training by getting kids to say hello to people they could care less about, getting them to do turn taking, which they could care less about. The only reason why they do it is somebody forces them to do it and gives them a few cookies and a couple of tokens for doing it. But they never ask to go, I'd like to do my turn taking activity now. How many kids actually ask for their turn taking activity? They don't. It's the last thing they want to do. But if they have to do it, they'll take a few tokens and a few M&Ms to do it. But they could care less about it. How do you get kids to ask other people to engage in social activities? Well, here's the reality. The reason why people ask other people to engage with them and people become important is because when they do, those other people add some value to what's going on. Why do you call somebody and say, come to dinner with me? You call them because you're going to dinner anyway, and their presence will add value to the dinner. Interesting conversation and an interesting time. So manding, as it relates to social skills, is about teaching children with autism that other people are useful to you, enjoyable to interact with. Here's how we do it. Quick example of this. This is Sylvia, the little girl you saw with that fast-paced instruction. That's her there with the pigtails. The girl in the dress is a typically developing girl, Megan. So we put Sylvia on the trampoline. She loves bouncing on the trampoline. But we put Megan on with her, and what did we learn? What did she learn? She learned Megan is a real advantage. Megan has added value. How does she add value? I have to expend less calories and energy when Megan's there. Because when Megan jumps on the trampoline, it makes the jumping better and easier and more fun, and I bounce in a different way. So Megan is valuable. The little girl in the dress.
Good, Megan. You ready? Set.
So now we pull Megan off the trampoline. Now we put her there. Megan's looking at the camera. We put her there, and now Sylvia's looking like, where'd that little girl go? But she doesn't know what to say. Now we teach her the appropriate, come play with me, Megan, or come, Megan, or something real easy for her to say. But now she cares about Megan coming. It's not like we're saying, say, come, Megan, good, you get an M&M. It's because Megan coming is actually the reinforcer. The same reason why you call people to come to dinner. Their coming is the reinforcer.
Come, Megan.
Maggie tells her what to say. Sylvia says something.
My turn. Go ahead.
She says, come, Megan. Good. There's my reinforcer for inviting another child.
That's it, Megan. Get her so she bounces. Like, bounce near her. There you go.
Bounce near her. Make it better for her. Make yourself fun, Megan. After several teaching trials where we prompted.
Come on, Megan.
That's it. Good. There you
Come on, Megan.
go.
Now she's asking Megan to come for the same reason you would ask somebody to go to dinner. It's not because somebody said, good job, you get 2 tokens for asking. Say, come play with me, come play. Very nice. The child could care less if the child comes and play. You're teaching the form. That's why it's an imitation of meaningful behavior. You've got to teach the function. The child's got to want the other child to come. How do you make the other child want it? You do it through manding. I think early social skills like eye contact and inviting other children, turning other children into reinforcers is really an issue of how do you condition other children as reinforcers through manding. I think that's where social skills begin. If you look at very early social skills in typically developing children, the demand is in there someplace. The motivation is in there someplace. I'll show you one more example right here of this.
Megan. Stay there, wait for her to look. She'll look. Come on, Megan.
Okay, okay.
You get the idea. Come on, Megan, and she says it. Example of social skills. Well, I hope this was useful information to you. I hope it gave you an overview of the conceptual, theoretical analysis, but then the practical application of that analysis in a way that is user-friendly. While I said I'm not sure all of you feel equipped at this point, and it wasn't designed to make you equipped to teach somebody an extensive repertoire, but I hope it gave you enough information to pursue other readings, other writings on this topic, and just to pursue the analysis so that either with the children who are your children or the children you work with, you're more likely to be able to teach verbal behavior using Skinner's analysis and a behavioral approach. Thank you very much for coming, and best of luck to you all. Thank you.
Thank you very much, Dr. Carbone. The session code, and this is session number 53. If you're filling out your Groupio feedback, it's session 53, and the verification code is YAP717. YAP717. Thank you.
And we're both Yankee fans, as you can tell. He didn't have much of a chance otherwise.